Yo, what is the deal? What's up, world? How y'all doing? We out here. Oh my God, this dude's already starting, yo. He's already starting. And we ain't even done nothing yet, man. We ain't even done nothing. What's up, world? How y'all doing? How are y'all doing? Hope everybody's doing well. Shout out to y'all. Today is Friday. Oh, what's up, y'all? Hey. I got 3 people that are up in here. Welcome to the TikTok live. Today is Friday. Your boy is he's sleepy. Had a lot going on this week, and I don't know if you guys can hear the other co-host in there. I don't know what he's screaming about. He always screaming about something. He's teething, I'm pretty sure, and he got like his canines coming in, so he just don't know how to act. He just want to yell at everybody, throw stuff. Y'all know how that goes. What's up with everybody? How y'all doing? How's everybody's week? My mom's here, and she's always hyped because she is like, I know him. Oh. Tell her I know her too. Be like, hey, what up? But yeah, the week is over. Got a 3-day weekend coming up. So everybody that's in school get that 3 days to kind of recoup and get your study on, catch up on some sleep, all that good jazz. So how y'all doing? We got 4 people that are in here, 5 people that are in here. Shout out to y'all. Hey, so for today, for the 6 of y'all that are in here, or the 8 of y'all, or the 10 of y'all, or however many people decide they just want to sit in here and listen to me run my mouth, we're going to go over some NCLEX style questions today, or NCLEX questions today. We're going to do our housekeeping and all that good jazz, talk about, whatever nursing stuff happened this week. If anybody got us anything else to talk about, we'll talk about that as well. And so, of course, if you're new here, welcome. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys check those out. But if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. So are you a nurse? Have you been a nurse? Are you an LPN or LVN? Are you an RN? How long have you been one? Are you a nursing student? Are you a prereq student? Did you just now say today, like, man, I want to be a nurse? Are you a nursing student, like actively in nursing school? Take your NCLEX. Have you passed your NCLEX? Did you fail your NCLEX? All that good jazz. So what we're trying to do is trying to foster a good environment down here in the chat. My co-host, Nurse Nelly, is here. She's actually doing some charting while she's up in here. So, shout out to her. Been a nurse for 4 years. She's done med-surg, tele, ICU, and now does case management, loving her life. So shout out to Nurse Nelly doing her thing. She is one of the co-hosts. So letting y'all know, y'all play around in my chat, she gonna ban you. I'm just letting y'all know that right now because we don't play no games in that chat, right? So trying to foster a good environment. Hey, if you want to be constructive and start asking questions and stuff like that, cool, do it. But if you start trolling, I'm gonna troll you. Then I'm gonna give you a 600. And if you don't know what a 600 is, a 600 is essentially 600 is 600 seconds, right? 600 seconds equals 10 minutes. 10 minutes, that's how long you're gonna be banned. But I just like saying 600 because when I banned you, I'm gonna ban you forever. So don't come around here acting stupid. All right. Make sure you guys smash that like button. Make sure you guys share. We're going to be going over some stuff. And I need 10,000 people to love me and like me, yo. Like, I need for y'all to get up on here. I need for y'all to like it. I need for y'all to love it because TikTok won't let me be great to be able to stream, this stuff off the computer until I have 10,000 people. Maybe I should start doing more dancing videos or, NPC videos. People love that stuff, so maybe I should start doing that. But anyways, if you're a brand new nurse, just started school, and you're looking to get a jump on your NCLEX journey, check out the 7-day NCLEX course. That link is in my bio. It's going for $48, 80% off of its total price right now. Once you get it forever. So check that out. I actually just updated, I uploaded 3 videos today and about 4 or 5 videos throughout the week. For pharmacology and some for endocrinology. So what we're talking about, SI, ADH, diabetes insipidus, talk about hypoglycemia, working on one for DKA, all that good jazz. So make sure you guys go over there, check that out. And if you don't need it, hey, share it to somebody else. You never know who might need it. But I need y'all to share because most of the time people don't like it when they're just staring here looking at my face. Unless they start coming in with the comments saying like, oh my God, you look like Jason Derulo. And I'm just like, girl, you the one. It don't matter. Anyways, so shout out to y'all. Yo, we're here. We're having a good time. I'm a big jokester. That's what I'm all about. I like to come over here. I like to have fun. But we're gonna talk about some stuff. NCLEX stuff. We're gonna talk about nursing stuff. You guys got any questions, comments, concerns? Drop them down there in the chat. Ask your question. Somebody says submitting my application next week. Submitting your application next week, Rosie, for school, like to go to nursing school. Shout out to you. I'm assuming that's what that's for. So shout out to you. You want to know one really good way to stand out when you're submitting a nursing application to go to school is volunteering at the hospital. If you volunteer at the hospital where there are patients, because that is the type of occupation you're trying to put yourself in, volunteering like with the Red Cross or whoever is at the hospital, which is usually the Red Cross, or they have their own volunteer organization, they write up a letter that you can submit with your package. It makes you look good. Just saying. Rochelle, look, first of all, you were here on Wednesday and you left. You ain't think we noticed, but I'm telling you, other people noticed that you wasn't here. You can't leave unless you be like, hey, y'all, I'm leaving. You got to announce yourself. You got to, you got to do something. You can't just be bouncing like that, leaving like a leaving person. All right. You can't be doing all that. Can you walk through the difference between BSN, LPN, RN, et cetera things? So BSN and LPN. So a BSN is a 4-year nursing degree. LPN is is essentially you can get like a diploma or like a certification, so to speak, but it gives you your criteria and all of the things that you need for you to become a licensed practical nurse. A registered nurse is exactly that. It's a registered nurse. You're going through either a 2-year or a 4-year type of degree plan. That's what that is. Third semester, and I'm so ready for practicums. I bet I take it in May. So I just want to know how much studying to put on meds. Pharmacology, if you're asking about pharmacology is the second largest section on NCLEX. But pharmacology is also embedded into those management of care questions, so on and so forth. So medications is important. And don't think that just because you're doing medications now, studying for your exam, that they're going to go away. They are not. They are not going to go away. Once you get on the floor or once you start working wherever you're working and you're working with medications, it's never going to go away. Ever, ever, ever. I like to use the example of Redonda Vaught. She is the martyr of all nurses by giving somebody the wrong medication because, I'm pretty sure maybe she had that thought process, like, how much do I need to study for meds? All of them, so you don't know the wrong ones to give. I'm just saying. I had to make dinner. Look, Rochelle, did you announce to everybody that you had to make dinner? No. Did you offer anybody dinner? No. First of all, what'd you make? It better have been good, too, if you had to leave us. You know what I'm saying? Rosie said, great tips. You're welcome. Not a problem. What else you guys got? Shout out to all 30 of y'all that are in here. At one point, I think I had 100 people in here, but they were just like, nah, I can't stand looking at him or whatever. You know what I'm saying? So what else you guys got? Shout out to everybody that just jumped in here. If you just jumped into the live stream, my name is Kevin. Go by the Boot Nurse on all social media platforms. But I want to know who you are, where you're from, where you're at in your nursing journey. And what questions do you have? So like we're talking about NCLEX. We're talking about, hey, are you a pre-nursing student? Are you a nursing student and like you just now started this week or last week, or you started here in the next couple weeks? You graduate, first job, we got a whole bunch of people that are in here going to be asking the same question, as well as people that have been in your shoes, such as myself and Nurse Nelly, who is my co-host down there. So for me, been a nurse for about 3.5 years. I've worked in ICU, I've worked in PACU, and I've worked in the operating room. So have a little bit of experience in a couple of different spots. So yeah, what else you guys got? Mama made schnitzel. Shout out to moms. I'm from Philly, taking Patho. Okay, I like Patho. Patho is actually a really good class. In my opinion, it's one of my favorite. Our school doesn't have us do many skills during clinicals. Will our first hospital expect that? Your first hospital will expect for you to know the basics of the basics. But when you get to your first job as a new grad, they're going to put you through a preceptorship or you'll be in a residency. So essentially it'll be like being in school all over again, but you're getting paid as a nurse. So I wouldn't say that they expect it, but I mean, the things that you've learned in school, I would expect that they would expect for you to know, at least the basics of, of what you're doing. Not saying that you're going to be perfect at everything, but yeah, you're going to be definitely thrown in to all those tasks. So you better be ready for it. If your school's not allowing you to do skills, which is actually really weird. Like, I don't know why school won't let you do that. I'm doing prereqs right now after not being in school in years, and I'm so scared. Well, don't be scared, man eater. You ain't scared to, let me stop. Anyways, don't be scared. The only way to actually get through that is actually to put yourself through it, right? So once the butterflies and once the anxiety gets done with going through your first class, second class, then you'll be in the mode and the routine of going through your classes and you're going to be fine. Mary, NC, ER nurse, second year as RN, paramedic for 16 years, EMS on the AMBO. Shout out to you, Mary. Shout out to you. I started fundamentals in farm. Hey, those are two big and important classes, Emily. So you really got to buckle down. You definitely got to buckle down for those two classes. From Massachusetts or Massachusetts. I've been a bedside nurse for 30 plus years. Good luck to all the students. 30 years, Lord have mercy. Shout out to you, 30 years. I already know that I couldn't have been a nurse for 30 years. And I'm saying by that, I mean a bedside nurse, because the way that my back is set up, my checking and my savings and my disability, it just don't work like that. One of our instructors almost lost their license from a student mistake, so they restricted a lot. Oh, okay, I see. It's a little bit different, I guess it is here, because although the instructors are here with the students as adjunct instructors, the students, although the responsibility of the school, the nurses are still responsible for the actual patients. I mean, of course, that goes off of the instructor's judgment and the nurse that's in charge of the patient's judgment, so on and so forth. So, are you Haitian because Massachusetts? No, I'm not Haitian. At least I don't think I am. But no, I was like Massachusetts. What's your favorite area of nursing to work in? Well, I've only worked in 3: ICU, PACU, and OR, and I like the PACU out of the 3. Can you talk about your OR experience? I'm in my last semester picking a specialty, thinking of OR, ER. I liked OR. OR, you got one patient, and you're almost never alone, because it's going to be you, a surge tech, anesthesia, and the surgeon. You're going to have at least 4 people. So you'll never have more than one patient at a time. What's up, neighborhood nurse? Are you in my neighborhood? I'm just saying. So with ER, that's chaos. Controlled, most of the time, chaos. If you're all about the adrenaline rush, if you're all about, getting all the emergencies and the traumas, and, if that's what you want, hey, do it. I was an EMT long time ago. And I enjoyed the fast things. I enjoyed the rush. I enjoyed all that. But it's just like, after a while, I was like, nah, I got to go. Some people can be in the ER for like 20 years and they love it. And shout out to all y'all that want to do that. But not I, sir or ma'am. But OR is cool. OR is cool. And yes, you can go straight into the OR or the ER as a new grad. You just got to join into whoever's residency program that offers it. So, and also you got to think about if those are the areas that you want to go to, but they're not available in your area. Look to going out of state, or look to going to a different town and seeing what's available. Get your traveling shoes on early, if that makes sense. So, studying for the first test of my first semester for my ADN. How do I stay focused? So the one thing that you need to do to stay focused is to get rid of all the things that are making you unfocused. So this phone, is it aerial? I'm pretty sure you probably go on the phone, scroll, you sit on the toilet and you scroll through TikTok and laugh and do all the other stupid shit, because that's what I do. But get rid of your phone. And by get rid of your phone, I mean, take it out. Like, you need to recreate your testing center, recreate your study area. No snacks, no drinks, no phone. You need to practice, the way that that your test would actually be, right? And then you need to go over those pertinent areas. So I'm not sure exactly. You said your first test of your final semester. I don't know exactly. You're probably doing like management of care type, like transitions type deal. So definitely focus on those areas. But the biggest thing is all the environmental things that you 100% can control. People around you, all that other stuff. Okay. What's your advice in new grads jumping directly into a specialty? Like it. Do it. Look, Ariel, that's your name. Of course, I got to call you out. You're the one who asked the question. Like, what am I supposed to say? Anyways, but shout out to all y'all that are hanging out here. What else? What other question you guys got? All right, make sure you guys smash that like button. Make sure you guys share, because, I need other people to see this, right? And I already know what everybody wants at this moment, right? But there's nothing really going on in the nursing news right now, but I'm going to jump right into it. Most of my other folks aren't in here, but who want NCLEX style questions? Or who wants NCLEX questions? I already know the answer, because I already know that's what y'all want. Who wants NCLEX questions? Nah, not on the toilet. That's what I meant. But yeah, I'll try. Thank you. All right, cool. Hey, look, I didn't know if you'd be on the toilet like that. I'm just saying. All right. Marsha. Sorry, couldn't help myself. All right, cool. Let me get this all set up. Look, I need y'all to share. I need people to like me. First of all, I need all y'all to follow me. Jason Derulo. Hey, you must be new here, ABC. You new here? Because that's what people tell me all the time. That's my doppelganger. Tell him to send me some money, because shit is hard out here. You know what I'm saying? Anyways, so shout out to all y'all. Make sure you guys share. Make sure you guys like. And we're gonna jump right into this. Let me get this set up real quick because I just, obviously, this is how I have to do my life, right? NCLEX tips. I take mine. Okay, all right, check this out. So I'm about to turn this thing over right here, so you guys are gonna see what we got going on. Who said NCLEX tips? I take mine. And what's the name of the machine patients have in home for oxygen? CPAP machine? Are we talking about? So you take yours on October 3rd. So the one thing I'll tell you is recreate the testing center, right? Eliminate all your distractions, such as your phone, such as drinks, snacks, all that good stuff. Put yourself on a study plan. So if pharmacology was like the hardest section for you, you need to start there. Mine was pharmacology and pediatrics, and once I got all that under control, I was able to start taking. I took exams every time I was doing content. So I was doing content, then exams, and then I was reading and I was reviewing them right after. So that's what I was. No, a compressor, something like that. I don't know. It's not ringing a bell right now. Honestly, it's really not ringing a bell. But I might find it. It might click. All right. So here we go. Let's see what we got. Boom. There it is. All right, cool. So here we are. We're going to do NCLEX style, or we're just going to do NCLEX questions. So let me fix this. Let me get my life right. Rochelle says, in my third semester right now, when should I start focusing on NCLEX style questions? So I don't know how many semesters of school you're in, or how many semesters your school has. But when you get to your last semester, I would say, like, if you graduate in May, I would start studying for your NCLEX like beginning of April. Beginning of April. Let me see. Concentrator? Yeah, okay. How long did it take for you to get your ATT? It took me, I think mine was like either 2 to 4 weeks. I want to say it was almost 4 weeks it took for me to get my ATT. But I was in 2018. Nikki said, hey, Kev, guess what I got? You got some. Oh, Nikki, let us know. Let us know what the news is. And it's all because of Nikki. Let us know. What's the good news? I'm not going on until Nikki tells me the good news. What's up? What's up, Nikki? Let us know. Let us know. Let us know. Well, before Nikki decides she wants to do that, shout out to all 21 of y'all here. I need for y'all to smash that like button. So right now, we are going to do NCLEX questions. So number one, participate. Because I'm kind of, sort of, not really, but really funny. I just need for y'all to know that. Next up is, like, the more that you like, the more questions that you get. I'm just saying. There's a total of 25 questions that are right here. So guess how many likes y'all got to dish out? Ha! At least 25. I'm just saying. Last time y'all got me like to 23,000 likes, something like that. So, and I did like 20 questions. I'm just saying. It's all up to y'all. I will talk about the 7-day NCLEX course. A lot of people are just like, hey, I don't want you to talk about your course. Hey, if you don't want me to talk about my course, there's the door. Don't let it hit you with a good Lord split you. That's number one. But yeah, I talk about it because that's what I can do. Next thing, you trolling my chat, I'm going to troll you, and then you're getting a 600. I already talked about what a 600 is. That means we're going to ban you, and it probably won't be me. It'll probably be Nurse Nelly because she will see it way before I see it. So just saying. And there's no gatekeeping around here. These questions I got from nurselab.com. I thought they were pretty good, to at least get you in the mode of studying for your NCLEX, okay? Nikki, what'd you say? You said, I got my first interview at the hospital cardiac. Look at that. Shout out to you. You ain't had nothing to worry about, right? I'm going to tell you, I'm going to be completely honest. They need us. They need nurses out here. You see what I'm saying? So if they tell you no, cool. That's one door that's closed. There's another door that's going to open. You see what I'm saying? So shout out to you. Honey said, I just graduated. Congratulations to you, honey, for graduating. Now it's time for that NCLEX. I'm an LPN with 10 years experience. Look at that. Look at that. So shout out to y'all and LTAC, or what are they? Long-term care facility. Let's do some NCLEX questions. That's what we're here for. That's what we're doing. All right, cool. So as long as we all got that understood, we're gonna go on to this, right? So just letting y'all know, this is what's happening. These are the rules. Make it happen. And we gonna keep going. All right. I have a pinning ceremony in the 7. Trying to prepare for the NCLEX now. Shout out to you. All right. So here's our first question. Nurse Channing is caring for 4 patients and is preparing to do his initial rounds. Which client should the nurse assess first? You have A, a client with diabetes being discharged today. You have B, a 35-year-old male with a tracheostomy and copious secretions. You have C, a teenager scheduled for physical therapy this morning. And you have D, a 78-year-old female client with a pressure ulcer that needs dressing change. Obviously, your boy doesn't know how to talk. So, this is kind of where we are. Sorry if you guys hear my other co-host in there. He's screaming, doing something with his life. Apparently, I don't know. He's teething, but, he's just going to cry because, he's a brat. So, all right, I see B. I see a lot of B's going on there. I see a lot of B's. All right, cool. Is that Chalissa or Kalissa? I don't know. Honey says B. All right. Is that say he army tunes? Or hear my tunes? I said hear army tunes. It's hear my tunes. Oh, hell. Okay. All right. So Army Tune says B. Precious says B. All right, cool. Hey, look, I was hooked on phonics. He Army Tunes. Okay. Well, obviously. Sandal said B. Says B. B. All right, cool. Of course it's B. Of course, Kuda. Of course it's B, I think. All right, we're about to find out. Here we go. And of course, the answer is B. A 35-year-old male with tracheostomy and copious secretions. The patient with an airway problem should be given the highest priority. Part of ABCs, right? The ABCs identifies the airway, breathing, and cardiovascular status of a patient as the highest of all priorities in that sequential order. All right, cool. Shout out to all y'all that picked B. And, sometimes we got to start things out a little easy. Some people and some of us are a little bit further along than others, and that's cool too. So, hey, that's where it's at. All right. I think we are in the general consensus that it was B. And of course, whenever you are reading your question, even if you know it and you get it right, read the reasons why these are incorrect, because you never know when you'll get another question, like we'll say 7 or 8 questions down the line that can honestly be the same thing, but just written differently to give you one of these answers. Okay. And, there's nothing wrong with getting all that extra content. All right, cool. Here we go. All right. Question number 2. Nurse Janice enters a room and finds a client lying on the floor. All right. So now we have a fall, like, an unwitnessed fall. Which of the following actions should the nurse perform first? So keyword first, based off of the beginning part of this question, you have a patient that's lying on the ground. I have no idea how they got there and nobody saw them, right? Cool. So what is first? Based off of 1, 2, 3, and 4, sequential order, what is the first thing that we do? Okay. So we call for help to get the patient back to the bed. Establish whether the patient is responsive. Assist the client back to bed. Ask the client what happened. A lot of people are saying B. A lot of people say B. B, 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 B. B, 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 B. All right, cool. All right. He Army. I'm just going to say he Army. That just actually sounds funny. Just because I'm slow and that's why that's how I said it. So I'm going to just say he Army. I would have thought C, but B is cool. Okay, honey. Well, if you think B is cool, that's cool too. So, but if you want to pick C, that's cool too, because we'll eventually find out what the answer is. You know what I'm saying? So that's all good. That's all good. All right, let's see. So, it's B. Okay. B. Some reason I feel like it's A. Well, it could be A. Kia says B. Chris says B. Precious says it's B, D, A, C. Well, it's only one of them. So which one do you want? So obviously B is first. I'm assuming you want it to be B or A. Anna Maria. It can only be one. Okay. User 50 says A. Okay. B. You stay with the patient. Okay. Avery says B. Avery, I remember you, Avery. Welcome back. Nubian girl says B. You have to assess first. Okay. Melanin says B. Is that Felicity says B. Ashley says B. Here's a cool question. Patient is sort of okay. Well, we're not answering your question right now, guy. We're answering this question that's right here. It says B, the word first implies an assessment should be performed. Okay, cool. We're thinking about ADPI. I like it. Remember, it's first, not what's most, right? So let's see. It's B. All right, assess the client's current level of consciousness first to determine whether the patient has had a loss of consciousness, then do the remaining choices if possible. So when you said B, C, A, D, I think that's what you said. So there it is. Right. Where were we at? The initial step is to evaluate for reactivity using objective measures, address the patient verbally, progress to light shaking, then progress to more intense mechanical stimulation, right? So if they're unresponsive, you can do freaking, is it like the sternal rub and stuff like that, right? So Jasmine says, what's the answer? Jasmine, I just gave you the answer. I'm sorry that I'm not moving at your speed, ma'am. But hey, that's where we are. That's where we are right there. All right. Shout out to all y'all. Make sure you guys like. Make sure you guys share, because you never know who may need this. You never know who may need this. All right. So, all right. So I think we're good on that one. We'll go ahead and move to the next one. All right. So here we got question number 3. Paige is a nurse preceptor. All right. So paint a picture. Think about who Paige is. Who is working with a new nurse, who is Joyce. She notes that Joyce is reluctant to delegate tasks to members of the care team. Right. And by this question is saying that the nurse is the RN, right? Because the RN delegates to the other team members, which include the LPN and the UAP. Paige recognizes that this reluctance is most likely due to A, role modeling behaviors of the preceptor, B, the philosophy of the new nurse's school of nursing, C, the orientation provided to the new nurse, or D, lack of trust in the members of the healthcare team. Chris says D. Let's say Coco. Coco says B. All right, cool. BX says D, and a Maria says D. A Pawn says D. Ferb says D. B. MC91 says D. Linda says F. Look, that ain't even on here. You're like 2 letters past that. F for failure, probably. D. Got some C's on there. Okay. A. Honey says A. All right. All right. What else? What else we got? I don't think it's D or B. Okay, Rochelle, if it ain't D or B, then it's either A or C for you. User 61 says A. He Army says B. Yo, that is hilarious. And Maria says A. Ashley says B. Rochelle says A. Rochelle, you sure? You sure about that? Is it Sarah says C? The other Sarah says C. User 61 says A. Okay. D since she's new. Okay. All right. Shout out to all y'all. Sylvia says D. Okay. All right. Don't do that. What I do? What did I do? Honey, what'd I do? Oh, the sure. Tabitha says A. Lisa says D. All right. Well, it looks like we're kind of all over the place. Tia says D. It looks like it's mostly, if I saw, there was a lot of D's. A lot of D's more than anything that I saw. A lot more D's. Well, I guess D. Well, hey, you're not wrong if you guess if you don't know, right? So think about it. Think about it like if you're a new nurse, like you're reluctant to give people tasks. You're reluctant to do that. Like meaning you're kind of like you're scared. You're apprehensive. Maybe you feel like you shouldn't do it. C, you made her change. Oh, look, I didn't do that. First of all, I can't make you do anything. Rochelle changes her questions or her answers because that's what Rochelle does. And we've already accepted that. Ain't that right, Rochelle? Ain't that right? It's your fault, not mine. All right, here we go. I'm going to go with D. I'm trying to figure out what makes sense. Look, I got you. I'm going to go with D because everyone else went with D. I'm going to do the herd mentality. And I'm going to follow everybody. All right. So here we go. Let's see what the answer is in 3, 2. The answer was D. Look at that. Shout out to y'all. Lack of trust is the common reason for reluctance in a delegation of tasks. Some managers don't delegate because they feel they can work better than others. Since ultimate responsibility is of the delegator, they prefer doing the work themselves. What in the world? Oh, I was like, what the hell was that? They prefer doing the work themselves rather than getting it done through others. So that's actually that's a big deal. Shout out to whoever just gave me a mustache and a hat. Oh, it was Honey. I appreciate you. It made a noise and I was like, what the hell was that? So I appreciate that. Shout out to everybody who answered the question and got the question right. Because that actually happens a lot, especially like if you work in a hospital, because the RN is the one who's going to be ultimately responsible for whatever's going on with the patient. And if they don't trust you to do a job or a task, they may take that upon themselves. But then you got to realize like how many patients you have. And as the RN, you're only one person. So you got to develop some trust and you got to develop you got to be able to delegate these specific things and hold people accountable to doing what they're supposed to be doing. All right. So shout out to all y'all. Shout out to all the likes. Got 2,000 likes right now. Got 3 shares. Hey, I'm going to need at least 10. And I'm going to need like 97 of y'all to like follow me and be my friend. I'm just being real. Love me. Okay. Love me. I'm just keeping it real. Make sure you guys share it. Let everybody know what's up. All right, here we go. Question number 4. Nurse Paul is developing a care plan for a client after bariatric surgery for morbid obesity. Paint the picture. This patient is huge. Had a surgery, right? The nurse should include which of the following on the care plan as the priority complication to prevent? Is it pain, wound infection, depression, or thrombophlebitis? D. D. D, 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 D. Yep, D. Okay, I see some D's coming in. Ferb says D. Ariana says D. Okay. Felicity says B. Okay. All right. I see it. Let's see what else is going on. What else we got? Got D. Patrick says B. Okay. 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 Right. We got some D's, got some B's. So it's mostly D's and B's, but wow. Okay. There's a lot. There's a lot of B's that just popped up. Gabriella says D. Is it Kaya says, Nurse Kaya says A. Okay. Rochelle says definitely B. Rochelle. You sure about that? I'm sorry. Look, now I can't help it. It's Tony's fault, by the way. It's Tony's fault. Sonia says, okay, so Rochelle says 100%. All right. Bamboo says D. Tiffany says D. So we got a lot of D's over here. Asking priority. Okay. Post-op D. Okay. My bad, honey. Look, you set me up for that. Y'all unalive. Well, what'll unalive the patient? That's a really good way to put it. DD Glenda says A. D will. B. I had bariatric surgery. I think D. Look, if you had bariatric surgery, I need for you to not think. I need for you to know. That's no shade against you. I'm just letting you know that this is what we got. All right, cool. So y'all are all over the place. Got B's, got D's. D's, he can't ambulate. Okay, D, A. Man, y'all are all over the place. D makes no sense. Let's get the answer. Are you? Oh, see, at least you said please. So you know what, fiendish friend, you can be my friend. Not fiendish though, because it sounds a little addictive. All right, here we go. In 3, 2. The answer is B. The answer is B. So shout out to everybody that picked B. But hey, just because you picked D, don't beat yourself up about that. You know what I'm saying? Don't do that, because this is why you are in these positions, so you can see why the answer is right, but then why this answer is incorrect. That way, when you go to another question, you won't have that problem, okay? So wound infection is the most common complication among obese clients who had undergone surgery. This is due to their poor blood supply in their adipose tissue, aka their fat tissue, obviously because they're fat. From a surgical standpoint, obesity is associated with a multitude of complications, including impairment of cutaneous wound healing, total wound failure, and fascial dehiscence, right? And fascial dehiscence essentially is like wherever their incision is at, like it opens up and their wound just starts to, like if they have a wound and it's closed up by sutures, it starts to open up. And that's the dehiscence, the separation of the skin, the muscles, and all that other good jazz. All right. So who says he can't ambulate? That's true. Who said he couldn't ambulate? All right. Surgery, wound, infection. Yup. Exactly what I was thinking. Yup. Pain is a given. Facts. Infection, always priority, because the person just came from surgery, right? Wow. B for infection. Beep. Shout out to all 152 of y'all. First of all, I need 152 people to like me. And by like me, I mean follow me. And I mean share this. And I mean, smash that like button. And then every so often, just tell me how cool of a person I am. You can do that as well. All right, here we go for question number 5. A client presents to the emergency room with dyspnea, chest pain, and syncope. All right. Tell me what syncope is. Tell me what that is. Some people don't know. Right. So this is really good where your medical terminology comes into play, so on and so forth. Right. The nurse assesses the client and notes that the following assessment cues: pale, meaning they're as white as the background of this damn PowerPoint. Right. Diaphoretic. Right. A blood pressure of 90/60. A respiratory rate of 33. The client is also anxious and fearing death. Which action should the nurse take first? Right? Pain medication, IV fluids, dopamine, or O2. We got some B's, got some D's, got some B's, got some D's. IV fluids, okay. Faint, yep, fainting. That's exactly what it is, right? And I wonder why they're fainting. Probably because that blood pressure's so low, you know what I'm saying? So, O2. So what was that? What was that? That was D. Okay. Okay. BLS before ALS. Yep. Priority, airway, breathing, circulation, respiratory rate is too high for O2. Okay. Actually, I changed my mind. It's for sure D. You sure about that? Gabriella, you sure about that? I should just find that meme and just post it, like, or I should just like put it out like right in front when y'all are just like, I changed my answer. Like, you sure about that? Yes, sir. Ma'am, I got you. All right, I hear you. I'm picking up what you're putting down. B, it'll raise their BP. Okay. All right. Rochelle says airway. Emily says B. Belinda, not Belinda. Belinda. What did you say? Let me see. The ABCs. O2 is important. That's what Eric says. Okay. Tiffany says B. Kristen says B. Megan says B. Avery says D. Okay. Y'all are all over the place. Shout out to y'all. Shout out to everybody that's participating. I appreciate everybody. Mia says D, or Mia says D. Joanna said, what'd you say, Joanna? Joanna said D. Okay. Brandy said, hey. Okay, Brandy, I don't even know what you just said. It says, hey, come on, say the answer. Look, okay. Hey, Brandy, you about to be the one I pick on. All right. People that rush me get the finger. You know what I'm saying? I'm working on it. Okay. I got you. Shout out to you. All right, so here we go. I think we got a general consensus of where we're at. Okay, so here we go in 3, 2. Let's find out what this answer is. Feeling of impending doom. Okay, there it is. There it is. All right, here we go. The answer is D. The promotion of adequate oxygenation is the most vital to life, and therefore should be given to the highest priority by the nurse. When the nurse needs to prioritize patients, Maslow's hierarchy of needs theory is used to decide which patient is to be seen first. A part of Maslow's hierarchy of needs is airway, breathing, circulation, which is a physiological element, or which are physiological elements that are needed for the body to survive and help determine one's level of health. Yes, DNA. DNA. What? Oh, D than A. I thought you said DNA. I was like, no, you can't have DNA. I mean, we do have DNA, but not in that realm. You know what I'm talking about. Anyway, shout out to y'all. Smash that like button. Make sure you guys share. I feel so proud. I just started nursing school 3 weeks ago and got it right. Shout out to you. Shout out to you. Hey, it'll get easier the more that you practice doing these questions. You always want to try to incorporate practicing questions throughout your week, even if you're in nursing school. Hyperventilation, aka needs more oxygen. Okay. I'd also give aspirin and 12 lead. Okay, well, that's not on here, Chris. So, I mean, you giving more, but I mean, you give more than, you know, you don't want to try to be like, I would do this, I would do that. Doesn't matter what you would do. It's based off of whatever the question is asking you. All right. We passed the nursing school, y'all. Hey, damn right, y'all passed the nursing school. Shout out to all y'all. Make sure y'all smash that like button. NCLEX World, you always assume you have the order. Correct, Avery. In NCLEX World, you have the order. You have all the help that you could ever need, so on and so forth. I'm ready for my NCLEX. I know you are. At least invade to most invasive. Okay, I got you. Tracking. I feel dumb. Brittany, don't feel dumb. Don't feel dumb at all. You want to know why? Because if you're not used to this, then you have to practice to get better, right? So, ready to finish the program. Shout out to you. Hi, I'm finishing my prereqs and applying in the spring, but I like these exercises. Always do these exercises. I think somebody had asked me where I got these questions from, and I found them on nurselab.com. I don't gatekeep. I'll tell you. Like it does me no good to be like, oh no, let me tell you where not to go find these damn questions. You can go find the questions on nurseslab.com. On top of, if you're in nursing school, you want to learn how to do a NANDA, it's there too. I'm just saying, practice questions will get you better. I'm just saying. I just started my 3rd semester. Saunders has good practice questions. Saunders is okay. I didn't like Saunders at all. That's just me personally, though. Thank you for having this on here. You're welcome. I do this every Monday and Wednesday and Friday. I may stop doing them on Wednesdays. Mostly it's just because I got other stuff to do. So what about the T's? Kelly, what about the T's? I like Archer. Archer is cool, too. Shout out to Archer. I like Archer. So Saunders confused me so much. Psalms. Ma'am, I personally don't like Archer. And I do not like UWorld either. So that's just me. All right, so here we go. Oh, man, we're out of break time. Hey, so if you guys are new here, welcome. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go over there and follow me. YouTube, X, gonna give it to you. If you do Thread, right? Make sure you guys go over there and follow me. If you know anybody that needs this and they miss it, they can go to my YouTube channel, subscribe, and I put all the TikToks that I do here, I put up over there. So that, and sometimes they're an hour, 2 hours, 3 hours. So, hey, whatever information that you feel like you need or they need, it's up there for you. Make sure you guys smash that like button. Hey, participate. I'm kind of, sort of, not
but really funny. I'm just being honest. Hey, I'm be honest. Ask Rochelle if I'm funny. Rochelle, if you give them the wrong answer, you're getting a 600. I mean, give them your honest feedback. Hey, the more that you like, the more questions that you get. There's 25 questions, so guess how many likes I want? Just saying. Hey, last time I got 24,000 likes and I did like 20 questions. Hey, we're trying to get higher. We're trying to get more. We're trying to get this out to people. Make sure you guys share it. Make sure you guys smash that like button. Oh, Rochelle, really? Oh, okay. All right, cool. We're at you. Also, I will talk about the 7-day NCLEX course. What is that? 7-day NCLEX course is exactly what it is. It's an NCLEX course. So if you're a brand new nursing student, just started school, and you got some time before you graduate, hey, check it out. 7-day NCLEX course. That link is in my bio. It's for $48. You get it. Once you get it, you have it forever. It's in the pre-launch phase. I'm updating it as we're going along. I actually updated about 5 or 6 videos this week. I actually updated 3 videos earlier today from the endocrine system talking about DKA. Talking about hypoglycemia, DI versus SIADH. And there was another one in there. I just can't really think of it right now. But hey, you get it. Once you get it forever. Hey, today's prices aren't tomorrow's prices. Just keeping it all the way real. Hey, and also if you are looking for like one-on-one coaching, you can go to thebootnurse.com and you can see that there as well. Okay. Also, if you're in my chat and you troll, meaning if you act a fool on my chat, I will troll you back. I will roast you. Then I'll give you a 600. That just means I'm going to ban you. 600 equals 600 seconds. 600 seconds equals 10 minutes. That's usually how long I would ban you, but I just like saying 600, so I'm going to ban you forever. So don't be in my chat acting a fucking fool. Don't be in my chat acting a fool. All right, cool. Love you. All right, going on to the next one. Not even a nurse or a nursing student, but I love these. Shout out to you, Tiff. I know I saw so many people asking questions, but I did not see them. Oh, also my co-host, Nurse Nelly, she's down there somewhere. Just letting y'all know what's up. She's been an ICU nurse. She's done med surg, done tele, and now she does case management, loving her life. Okay. Just letting y'all know that she ain't the one to play with either, but she will definitely answer your questions if I don't see them. I start my ICU clinicals on Thursday. Any tips? Samantha, be a sponge. All right. Ask questions. And when you ask questions, start to participate, start to put hands on patient. All right. And let your preceptors know, like, hey, I'm here to help. I'm here to do this and I'm here to learn, be as involved as possible. Like us as preceptors love that. You hide in the corner, then they're going to leave you in the corner. But if I was your preceptor, you hide in the corner, I'm going to bring that ass. Get over here. Come on, let's go. For those that don't know, I am a Navy instructor as well. I'm also a master instructor in the military. I've been in the military for 16 years. I've taught in a surgical technology program. I've taught in a whole bunch of other programs as well. So I've been teaching for quite some time. And I like to do these questions is because I didn't have this one. I didn't have anything like this. I didn't even know like anything like this existed because I was in my own little bubble. Right. So now what I do is I like to do these things for other people. All right. So make sure you guys share. Make sure you guys like. Make sure you guys follow. I need 10,000 people to follow me so I can stream this on my computer. Hey, watch this work. Watch the progression. Watch the progression, okay? It's a blessing to be on this live. That's what I'm saying. Heaven's angel. Don't know why I just started singing. Anyways, going on. We'll see what's up. Do you ever regret going into nursing? Haley, sometimes, but not really. The thing about nursing is that nursing is so vast. There's so many things that you could do. So many things that you could do. And you're not just, anchored down to bedside. You can go do anything like research. You can go work in clinics. You can be part of a medical devices company. There's so many things that you could do as a nurse. Don't ever let nobody tell you that you have to stay at bedside. Don't ever let people play with you like that. I mean, not regret, but have a moment of what the heck yeah, all the time. Especially when I was in nursing school, like, bro, what the hell is this? You know what I'm saying? Shout out to you, honey, for giving me the love and the heart and the crown because I am a king, short king. Shout out to all my short kings out there. Anyways, I'm a CNA and I want to move forward. I love taking care of others. Hey, and nursing is a calling. So people are just like, oh, I became a nurse because of the money, bro. I don't know if you know this, but at the beginning, you ain't really got no money. You know what I'm saying? So is this for RN? Is this for NCLEX, RN, and PN? Hey, so before I go on, let me tell you guys the big difference between NCLEX RN and NCLEX PN. The biggest thing is that you need to know what you can and cannot do. And that's it. Like when it comes to the content for LPNs, same pharmacology, the same. All the other content, the same. But you as the LPN need to know what you can do and what you can't do. You need to know what you can accept from an RN and what you can't accept from an RN. You need to know if my patient is stable and they become unstable, that they are no longer my responsibility. They have to be assessed by the RN at that point, right? So you guys got to know what you can do, what you can't do, what you can accept, and what you can't accept. That's the biggest thing. That is the biggest difference between LPN and RN. And I've been coaching for 3 years. So, and that's the biggest difference that I've seen. And you guys can go, if you guys want to go look on my YouTube or look on my TikTok and look at the testimonies of the people that I helped with LPN, like they'll tell you the same exact thing, right? So I'm just keeping it all the way real. All right, so here we go. Question number 6. The nurse receives a 11-month-old child with a fracture of the left femur on a pediatric unit. Which action is important for the nurse to take first? So remember, first versus best. First is systematic, 1, 2, 3, 4, right? And best is like, I can only pick one. And if it's only one thing I can do and leave, AKA to keep my patient alive, what would it be, right? So first, systematic, 1, 2, 3, 4, okay? So it says call for a social worker to meet with the family, check the patient's or check the child's blood pressure, pulse, respiration, and temperature, assess pain management or pain medications, speak with the parents about how the fracture occurred. Heaven says B. When you're a pre-med student, but watching this anyways, I'm going to go B. Hey, shout out to all the pre-med. Hey, you're a pre-med student. I think you're the first pre-med student that's in here, that I've ever seen at least comment in here. So I appreciate you. I think somebody said something about being a radiology tech or being an RN. Hey, did you know that? Hey, listen, did you know that you could be an RN and work in radiology? Now you do. Shout out to you, Nick. Shout out to you. Vital signs are important. Do you suggest going through the Army to have them pay for nursing school? Is that Jocelyn? That all just depends on you, on what you want to do. The Army is an avenue for you to get that way. You can do it through the Navy. You can do it through the Air Force. I'm not in school. Well, that's cool, Chrissy, that you're not in school. Are you trying to go back to school? Like, I don't know why you said that. Psalm said C or B. But D is also a close second. I'm sorry. Come on, Mr. Med student. Watching as an EMT. Shout out to you, Tori, watching as an EMT, CNA. Hey, just because you're an EMT doesn't mean you can't go be a nurse and then be a flight nurse at some point, or be an en route critical care nurse. Stop playing with me, Tori, before you get the finger. You see what I'm saying? People that act up get the finger. You know what I'm saying? All right. So if you're an RN, can you work an X-ray? Yeah, you can do that. Stop playing with me. Where did you get these questions? Hey, I don't gatekeep, so I got these off nurselab.com. What's the answer? Are you yelling at me? I hope you're not yelling at me. I'm trying to catch up on all y'all's answers, on y'all's questions. Important versus first, or important and first. All right, let me see what y'all said. I just started my MSN after being in critical care, paramedic for 5 years. Shout out to you, Chris. Shout out to you. I am CNA. Okay, son, I see you. Say B, B. All right, cool. So some people say B, some people say D. Let's see what the answer is. The answer is, it is D. Speak with the parents about how the fracture occurred. Now, you may not agree with it, but that is the answer, ladies and gentlemen. In case of injury, especially among children, right? Especially among children, it is very important that the nurse should first assess possible abuse, right? Because think about it. It says an 11-month-old with a fracture, right? My sense of humor is okay. If you tell me that I'm funny and you like me and you share, hey, I'm just saying. All right. So where are we at? It says abuse is one of the reporting responsibilities of the nurse. The first step in any child protection response system is the identification of possible incidents of child maltreatment. Medical personnel, educators, child care providers, mental health professionals, law enforcement, the clergy, and other professionals are often in a position to observe and or screen families and children to identify abuse or neglect when it occurs. That is very important. I guarantee you will see something like that when you take your NCLEX exam. Not even playing. Femur is a hard bone to break. Damn right it is. It is the hardest bone to break in your body. Second to that would be your humerus, right? So think about that. That's like, I don't know if anybody's ever heard of a femur break on an actual adult, but it's like if you guys have ever watched a baseball game and you see, like where the guys where they hit the wooden bats and the bats break and that's exactly what they sound like. That's exactly what they sound like. It's creepy, right? Yes, I'm trying to go back to school. I'm in Cali. It's super hard to get into a program. Hey, so here's another thing I want to tell you guys is that if you're trying to get into a program, like a nursing school program, and if it's hard to get into the program in your state, what is stopping you from going to another state? What is stopping you from temporarily, traveling to go to another state to get into another school? And then, get your degree, get your license, and then hop that ass on the next train going back home. You know what I'm saying? You guys got to really think outside the box if you really want to achieve that goal that you're setting for yourself. Okay? All right, so that was question number 6. Now we're on question number 7. Nurse Sky is assigned to the cardiac unit caring for 4 clients, right? He is preparing to do initial rounds. Which client should the nurse assess first? All right, here we go. A client scheduled for cardiac ultrasound this morning. A client with syncope being discharged today. A client with chronic bronchitis on nasal oxygen, or a client with diabetic foot ulcer that needs a dressing change. We got C. We got A. What'd you say? I had no idea if I passed or not. I was bummed until I found out I passed. Transgirl Pride. Look, check this out. Everybody that goes and takes that test, and I'm assuming that's what you're talking about, everybody feels that way. Everybody feels like they fail, right? Everybody feels that way, right? Just like I'd be like, hey, everybody's going to go and take their exam and they're going to be nervous. It's just a part of how it is, right? So it's all good. It's all good to feel that way. Calliope's here. Okay, I see you. Calliope says C. Eric says B because, hold on, before your question goes away, because they still have syncope if they're about to be discharged. Okay. All right. Because that's education, right? So that's a good one. I puked before and after mine. Are you talking about your exam? Look, that exam will make you feel some type of way. It'll really humble you. Let me tell you. What is syncope? Somebody tell I'm trash, or somebody tell that who is like Mr. Trash, Mr. or Mrs. Trash, or whoever that individual is, what syncope is. You missed it. We talked about it earlier. So welcome. Maybe B. Miracle says maybe B. Nick says D. Rhonda says I think it's A. Rhonda, you may be right. User 84 says D. Charlie says C. Airway comes first. Mrs. Stevens says C. Rochelle says, oh my God. Rochelle says C. I just want to let y'all know. If Rochelle says C, that's the answer. And if y'all get it wrong, it's because of her. Blame her. I'm just playing, Rochelle. I'm just playing. All right, we got C. I think it needs to be changed because wound care is first. Look, it's not about the fact that it needs to be changed, Nick. It's like these are the type of questions they're going to give you. So when people go and take the NCLEX, they're going to be like, hey, this needs to be changed. You think the NCLEX is going to want to hear you? Nope, they don't. Naya says C. User 46 says C. All right, cool. I really don't know, but I think it's C. Hey, a guess is better than anything, right? Rochelle says, like, don't listen to him, y'all. I'm not even. Hey, my bad. I'm sorry. I'm sorry. All right, here we go. Hey, so I just want to let you guys know that girl that has Tourette's. I think her name is Balin. So she's funny because of her Tourette's, her quips. Just letting y'all know, y'all may or may not hear some of those pop up. I'm just saying, just because I think they're funny and it kind of keeps things going. Shout out to all 416 of y'all in here listening to me run my mouth. Taylor, stop yelling at me, okay? Or you're going to get the finger. You understand me? All right, cool. Here we go. The answer is C. A client with chronic bronchitis on nasal oxygen. I know. First of all, travel nurse Nelly, ma'am, don't yell at me, okay? Don't yell at me, all right? Don't read into the question exactly, Kiki, okay? I knew it. You ain't know it. You didn't know that answer. Stop it. Brandon says, why? Because the rationale is right here, Brandon. I'm about to read it. A client with airway problems should be attended first, even though it's chronic, right? So, but let's see why. It says when the nurse needs to prioritize patients, Maslow's hierarchy of needs theory is used to decide which patient is to be seen first. A part of Maslow's hierarchy of needs is airway, breathing, circulation, which are physiological elements that are needed for the body to survive and help determine one level of health. Observing ABCs is a rapid assessment of life-threatening conditions in order of priority. But everybody else, whatever else, here go the rest of the rationales. I can't remember exactly what everybody else said, right? Because usually I get a general consensus. Caroline said it's too easy. Hey, it may be too easy. Some people got it wrong. So I'm saying, do you do any NL? I don't know what that is. What is that national? What is NLN? I forgot. Is that like, I don't know what that one is. You gotta let me know. Yay, I got it right. Shout out to you, Miss Stevens. I got it right preparing now to take the NCLEX. Look that you're doing this. I appreciate it. I love doing this. I wish I would have had something like this when I was actually studying, but hard-headed at one point, and then I wasn't really into TikTok back in the day because it was just annoying. You know what I'm saying? So, oops, I forgot. NCLEX is different. That's real life, of course. National League of Nursing is that a Canadian thing? I think that's Canadian. ABCs always come first. Tutor me. My NCLEX is coming. Hey, honey, if you want me to tutor you, go to thebootnurse.com and then look at the NCLEX, coaching and mentoring. And if you want me to tutor you, that's where I do it. Go to the next question. I got to go in for night shift. Are you yelling at me, Caroline? People that yell at me, you get the finger. You know what I'm saying? Everybody been getting the finger. Hey, y'all been testing me today. All right. We'll go to the next one. All right, cool. I need to be tutored also. All right, Naya. My goodness. Lord of mercy. Let's see. All right. Question 8. A nurse enters a room and finds a patient lying face down on the floor and bleeding from a gash in the head, right? Which action should the nurse perform first? Determine the level of consciousness. Push the call button for help. turn the patient face up to assess, or go in the hall and get the nursing assistant to stay with the client while the nurse calls the physician. Cal says B. Naya says C. Neighborhood nurse says A. Co says B. Charlie says A. Lisa says, what'd you say, Lisa? I can't remember. Lisa says B. Okay. Oh my God. Somebody said, I'm starting nursing school. Do you have any tips? I'm scared. Hey, I'm telling all y'all, if y'all are scared, go to church. Hey, and by the fact that I just said that, make sure you guys smash that like button. I love y'all. Don't be scared about going to nursing school. It's all about being prepared, and it's all about, you're going to have to get used to just being there. Okay. Look for murder in the room. What the fuck? Oh my God. Don't be scared of it though. Don't be scared of it. Don't be scared of going to nursing school. It's just a part of what it is. Okay. Call a rapid. Hey, so I just want to let you know, Eric, that a lot of things they don't talk about rapids on NCLEX, right? Because some places don't have rapid response teams, believe it or not, which is why they don't include it. They don't include a lot. Do you do any practice questions for PACs? I don't do PACs. So what's the answer? Hey, so first of all, you got to let everybody get a chance to answer. There's 500 people in here. You got to let people answer. Y'all are so impatient. I'm going to start pointing fingers at everybody. ICU is their own rapid response team. Facts. Exactly. The rapid response team is the ICU for everywhere else in the other hospital that I've seen, but some people don't have it. I'm just like, I'm in my last semester. I didn't see what that is. Y'all are going super fast. All right, here we go. So let's find out what the answer is. Never move the falling patient of the nursing homes. B, ask for help, then assess. Okay. A, C, you see them bleeding face down. Yeah. Caitlin says A. We got some C's, got some D or A. Got some B's. Okay, cool. Here we go. Here's the answer. The answer is A. Determine the level of consciousness. Assess the level of consciousness should be the first action when dealing with clients that might have fallen over. The initial step is to evaluate for reactivity using objective measures. Address the patient verbally. Progress to light shaking, then progress to more intense mechanical stimulation. So yeah, you want to assess, hey, are you awake? Okay, obviously they're face down and they're bleeding. You might want to turn them over. That would probably be the next thing I would do, right? But you definitely want to assess them first. Hey, are you awake? Hey, can you hear me? That's just how it is. Hey, look, I didn't pick the answer. I didn't pick the question. I'm saying I don't gatekeep. So if you guys want to know where to find this, you can go to, nurselabs.com. They have a whole bunch of other ones on there, right? And if you don't feel like these are that they're adequate for you, or if you feel they're too easy, hey, these are just the ones that we're doing, right? True, I have anxiety. Mine always asks for help. Kevin, I'm doing my first shift as a nurse extern in the ED tomorrow. Shout out to you, Calliope. You're gonna do Gucci when you get out there. I said nurseslab.com. That's where they have. So if anybody that's in nursing school and you want to learn how to do your care plans, where you're learning about how NANDAs or nursing diagnosis and all that other good stuff, nurselab.com is great. I'm just keeping it real. All right. Yep. Nurses Labs. There you go. All right. So here we go. Next question. The nurse is working on the night shift with a nursing assistant. The nurse assistant comes to the nurse stating that the other nurse working on the unit is not assessing a client with abdominal pain despite multiple requests. Which of the following action by the nurse is best? So keyword, best. So we paint a picture. Your nursing assistant is coming to you telling you that the other nurse is not doing what they're supposed to be doing when it comes to assessing your patient with abdominal pain. So what is the best thing that you should do? The one thing that I would do, I can only pick one. And if it's the one thing I would do, what would it be? Ask the other nurse if she needs help. Assess the client and let the other nurse know what should be done. Ask the client if he is satisfied with his care. D, contact the nursing supervisor to address the situation. D, B, D. Okay. Right. Should be A, but the answer will be B. Probably. In reality, right? Maybe. I can't even tell you how many times I've worked and I've seen other stuff happen in other people's rooms, like their drips would run out or their patient would ask for water or they say something about pain or whatever. And I would be like, all right, cool. Let me let your nurse know. Or, okay, cool. I got you. You know what I'm saying? So don't be surprised if you have to do that in real life. I'm just saying. All right. So I got D's and I got B's. I got B's, D's, not snitching. Wow, honey, really? She's like, I ain't telling nobody. Can't be B. It's unsafe. D, but I'm not a snitch. And y'all, wow. What would the nurse do first? I would choose D. B. Mel says A. Call me a snitch because I am. Shout out to you, Rochelle, for being a snitch. I'm letting all y'all know, the moment that it says your first name, your last name versus the United States of America, all y'all snitching. All y'all some 6'9s. All of y'all. All of you. All of you. Oh my God. Shout out to y'all. All right, cool. So we got A. We got A. Rochelle says, hello. Girl, that's what I'm talking about. I'm just saying. I'm just letting all y'all know. Y'all better stop playing games saying y'all ain't gonna snitch. Stop playing with me. I really don't care if she gets in trouble. There you go. Hey, it's all about patience. Hey, Karina. Hey, don't do that. Don't yell at me, okay? Anytime everybody asks me what the answer is, you know what I'm saying? Is this NCLEX? Yeah, you know it is. All right, here we go. It's D. Contact the nursing supervisor to address the situation. I really should have just put, like, in quotes over here, I should have just put snitch. That's what I should have put. Oh my God. Here we go. The nurse should use a proper channel of communication. The nursing supervisor is responsible for the actions of the different members of the nursing team. Assessment and treatment of pain is often complex. The standard definition of pain is whatever the experiencing person says it is, existing whatever the experiencing person says it does. Remember, pain is subjective. It doesn't matter what you feel, it matters what they feel, right? Always snitch. Hey, I'm just saying, hey, because you got to think, hey, here's the reality of it, is that when you get your license, it's you. None of these hospitals give a fuck about you. And I'm keeping it all the way real. So the best thing that you need to do is, if it's not your patient, you got to let somebody know, like, hey, this is going on. We always want to do patient safety first, right? We always want to do patients. Exactly, Eric. We always want to do patient safety first. But I'm telling you right now, the patient safety is first, but I'm definitely telling somebody, like, hey, Rochelle ain't doing what she's supposed to be doing. I'm gonna need for y'all to handle her. And that's on the dead homies. You know what I'm saying? I'm just playing, Rochelle. But y'all know what I'm talking about, all right? So don't come around here playing these games. Don't come around here playing these games. Oh, now you snitching? Man, no. I'm snitching on everybody. All of y'all, 200 and some change in this chat, all right? This is the only place on TikTok I want to be. Look, that's what I'm trying to tell y'all, man. Stop playing games with me. All right, hey, we're going to the next question. Here we go. Question 10, Nurse Vivian. Y'all notice how I skipped the nurses' names because sometimes I couldn't say them? Anyways, Nurse Vivian is reviewing immunizations with the caregiver of a 72-year-old client with a history of cerebrovascular disease. The caregiver learns which immunization is a priority for this client. Think of the age, right? Think about the past medical history, and think about what medication that they would need, what vaccine they would need. Hep A, Lyme's disease vaccine, Hep B, or pneumococcal. D, I see some folks saying D, risk of pneumonia or pneumonia. I heard somebody literally say that, and I'm just like, please leave. Please just exit that door. D, this is a hard one. Calliope, okay. Definitely a little difficult for some folks if you've never been exposed to it, right? Definitely a little bit difficult if you've never been exposed to it. Brianna says D. Is that Gabriel? Says D. Charlie, I don't know why you're laughing. What I say? It's D. Okay. Hey, shout out to all of y'all. All right. How long has this live been going on? I started about 5:30, so a little over an hour right now. Nurse here. Okay. Pikachu says so easy. Hey, maybe easy for you, but may not be so easy for others. Okay. So some people don't know, what the immunization schedule is. But hey, one of those things you need to know is the immunization schedule when you are taking your NCLEX. Okay. It's easy. Hey, it may be easy for you, but it may not be easy for others. ABCs always first, right? D, user 55, not a nurse, but A. Okay, shop Gen X. User 55 says A. All right, cool. Shout out to y'all. I think we'll get this answer real quick. Let's see what's up. Hey, we're at question 10 already. We're at question 10. All right, I'm just letting y'all know. I'm just letting y'all know what's up. All right. Plano, Sarah, I'm guessing you're from Plano. But not B. I have it. Sorry. You probably answered this a million times, but where can I find these questions? Nurseslabs.com. These are where I'm getting all these type of questions from. D, C, B. Frosty says D. Kaylin says D. Kayla says D. KT says not something else. Oh, it's not D. Okay, got you. Lucy says D. Mia says D. All right, what's the question? You stop going on. I already. The question's right here. What you mean? It's right there. All right, D. All right, so here we go. Here we go with the answer. All right, y'all ready? In 3, 2. Listen, did you know that that girl that created the combat gel is going through some drama with some other girl on TikTok? Now you do. Hey, I'm just letting y'all know I love that dude. That dude's awesome. That's the only reason I did that. All right, here we go. Hey, so here's... Hey, if y'all are new, hey, this is what I like to do. This shit is so funny. It's free, by the way. I'm just like, who is your worst enemy? I got some, I don't know, whoever don't like me, I guess. But anyway, hey, so the answer is D, pneumococcal vaccine. The pneumococcal vaccine is a priority immunization amongst the elderly, especially those with chronic illnesses. It is administered every 5 years. The pneumococcal vaccine is indicated in the United States for all adults 65 or older, and as well as younger patients with conditions that increase the risk of developing pneumococcal pneumonia or invasive pneumococcal disease. I was right. It's D. Yes. That's what I'm talking about. All right. Is that Jamisha says, thank you. You're welcome. Shout out to all 394 y'all that are hating. It says, God, I hate studying for this. Made no sense. Florida is Hep B for sure. I don't know what that means. What do you mean? What do you mean, Super TikTok 20? What do you mean? Hey, shout out to all 343 of y'all. Hey, right now we're doing NCLEX questions. All right. Number one thing I want y'all to do, I want y'all to participate. Give me them answers. Let me know. I'm kind of, sort of, but, not really, but really funny. I'm just like, you know what I'm saying? So I'm just letting y'all know, hey, the more that you like, the more questions that you get. I'm only at 9,400 likes. You know what I'm saying? So I got 25 questions. I got 25 questions right now, y'all. 25 in the chamber, right? And I'm ready to let it spray. Y'all know what I'm talking about. You know what I'm saying? 25 questions total. So guess what? Guess how many likes y'all got to dish out? 25K. I'm just saying. I'm just letting y'all know. Hey, I'm just letting y'all know. Y'all got to show me some love. Show me some love. Hey, share. Hit that like button. Hey, make sure you guys follow me. Hey, if y'all don't want me to do this right here so I can stream from my computer, my fancy ass, nice ass computer, I need 10,000 people to be my friend. You could be my friend. I'm cool. I'm all right kind of dude. You know what I'm saying? But I need for you to like me. I need for you to like me. I need for you to share it. I need for you to follow me. Follow me on everything. Hey, make sure you follow me on YouTube. If you know somebody that needs this and they miss it, they can go over to my YouTube channel, subscribe, and this TikTok live will be uploaded there at some point within the next couple of days. Okay. So make sure you guys do that. Hey, are these RN or LPN NCLEX prep questions? I'll answer your question in a second. Hold on. And yes, I will talk about the 7-day NCLEX course. What is that, you ask? It is a NCLEX course and it's going for $48. That link is in my bio. It's in the pre-launch phase. It's still being updated. I actually updated 3 videos today from endocrinology, which is a really big portion, or which is a portion of what you need to know for NCLEX, both RN and LPN. Okay. So, yeah, it's for $48. Once you get it forever. I'm just letting you guys know. So mostly it's for anybody that's studying for NCLEX. But since it's still in the pre-launch phase, I try to get it to those individuals that are going to be taking their NCLEX within the next 6 months or 6 months and further. But the NCLEX review and all this other good stuff is going to be up here shortly. Those are the things that I'm working on right now because I hear what you want. And I'm going to give you what you want, which is a review and how to answer NCLEX style questions for new generation NCLEX, all that good jazz. All right. So I'm here for you. Let's do endocrinology. Look, we're not doing endocrinology, Kayla. We're not doing that right now. We're just doing whatever's over here. What kind of nurse are you? I am an OR nurse. Ty Patrick, if you're asking did somebody really just come up here and ask me what my credentials were? I've never heard somebody ask me that. Or what are my qualifications? Man, I feel like I'm at a job interview. Ty, you interviewing me for a job? Really need this. All right. Shout out to you. What kind of nurse are you? Okay. I got you. Do endocrinology. Let me go. Let me keep going. I love this. Even as an RN, it's awesome to review facts. God has answered my prayers because I plan on taking mine in the next few months. Shout out to you, Heaven's Angel. Same. I graduated in December. Send your resume. Look, I got a resume. Hey, where's that? Hold on. Let me see. It literally is somewhere. Oh, it's right here. Let me see if y'all can see it. Can you see it? No, you can't see it. It's literally right here. It's right here. And I got a curriculum vitae if you want that as well. Surgeons are the worst. They are kind of the worst sometimes. I'm just saying. But they be trying to come at me crazy. And I'm like, hey, bro, I'm not your wife. I'm not your son. Don't talk to me like you lost your mind. Because you might slip around one corner and catch these hands. Ty asked me if I was a nurse educator. No, I am not a nurse educator. However, I am an educator. I'm a master instructor in the Navy. I was a surgical technology instructor for 3.5 years. I've been a nurse for 3.5 years. I've worked in ICU for a year, worked a little bit in PACU, and I worked in the operating room. So I'm essentially an OR nurse, but I do have the other experiences in those other areas. I worked in a burn ICU for 6 months, and then a medical and a neuro ICU for another 7 to 8 months. And so, and I did that during the second wave of COVID. So there's that. I don't like being called a baby nurse. That's why my name is the boot nurse. And it's the same exact thing because I'm a grown ass man. You know what I'm saying? Whoop, whoop. So I'm just keeping it all the way with more experience than me. And that's all right. Angelica, what's up? What's up? Shout out to all 202 of y'all. We're going to go on to the next. Kayla, stop yelling at me. Hey, you about to get the finger too. You understand me? I'm be yelling. All right, cool. Here we go. Next question. Oh, y'all got me to bruh. All right, I guess y'all getting all 25 questions because I didn't even realize I was at 25. All right, here we go. You're admitting a patient for whom a diagnosis of pulmonary embolism must be ruled out. The patient's history and assessment reveals all of these findings. Which finding supports the diagnosis of a pulmonary embolism? So if you don't know what a pulmonary embolism is, you might want to break this down medical terminology style. You see what I'm saying? Might want to break that down. So we're trying to rule this out. So what are the findings of a pulmonary embolism, right? So a patient was recently in a motor vehicle accident. Patient participates in an aerobic exercise program for 6 months. Patient gave birth to her youngest child 1 year ago. Patient on bed rest for 6 hours after a diagnostic procedure. Hey, so here's a really good hint. This is something that if you're a brand new nurse or even if you're a seasoned nurse, something that I've learned is I've always said to somebody is like the hospital is the most expensive and uncomfortable hotel you'll ever be in, right? So one thing you tell them, hey, like nobody ever got better lying down. Incentive spirometer, baby. Hey, I hear you. And so I'm just saying, get that ass up, keep and move. All right. We got A. Had a whole bunch of people say D. Had a whole bunch of people say A. Okay, cool. Shout out to y'all. A, D. Rochelle, I ain't see you answer nothing. I bet you Rochelle dipped out because she got mad because I said something about, I need rationale. Well, Tori, you'll get the rationale once I get enough answers. I'm just saying. All right, cool. Look at that. All right, what we got? Ambulate. Okay. Ray says D. All right, cool. Cammy says D. Tracy says D. The wording of the questions are wild. They are wild. I know somebody else had said something about that the NCLEX is unrealistic, and whoever said that, hey, drop that question again. I want to answer it. All right, here we go. We're going to answer this question in 3, 2, oops. There we go. It is A. A patient was recently in a motor vehicle accident. Patients who have recently experienced trauma are at risk for deep vein thrombosis and pulmonary embolism. PE remains relatively common after trauma and occurs in the absence of lower extremity or spinal fractures. Although PE is usually thought to occur between days 5 and 7 after injury, data suggests that as many as 37% of pulmonary emboli occur earlier. Let me tell you something right now. The one thing that once y'all become nurses, the moment that you see a pulmonary embolism, and like when you're on the floors or whatever, and you hear the term, "Hey, he threw a PE," that means that an emboli, a clot of some sort, made it all the way to the lungs. And I'm telling you right now, the moment that you see it, you'll never forget it. And when you see it, it will traumatize the shit out of you, right? It will traumatize it will traumatize you. And this is what you're gonna hear. They're gonna be looking at you. They're gonna be trying to find positions of comfort. They're gonna be having difficulty breathing. Like it's crazy. And then next thing you know, when they move a certain way, because remember this clot is still moving. Next thing you know, you're gonna hear is and when I tell you their eyes go from like this to like that, and they get as white as the background of this dent. Look, I'm trying to tell you, right? That shit is crazy. The first day I saw it, I was like, bro, what the hell just happened here? And it was during COVID. That I saw it for the very first time. All right. So I'm just letting y'all know anytime that you have it or anytime you see it, just be ready for it. The site was nurseslabs.com. All right. I thought for sure it was D. What did you do? At that point, they had to code them. So we had to start CPR. Yeah. My son got them from COVID. Crazy. Yep. There's a lot of things we learned about COVID. COVID caused a lot of PEs. Yep. Sure did. All right, so we're going on to the next one. Shout out to all y'all. 27,000 likes. Hey, y'all must really like me. Y'all must really like me. I appreciate it. All right, so question number 12. You are assigned to provide nursing care to a patient receiving mechanical ventilation. So if somebody's getting mechanical ventilation, what y'all think? What do you think is inside of their mouth? Which action should you delegate to an experienced, experienced nursing assistant, experienced UAP, right? Assess the patient. All right, so here's another thing I'm going to tell you. Even if you know what the answer is, you better read the answers all the way through. You better read this all the way through, because you could get all the way to here and then be like, all right, I already know the answer, right? Or you could miss this word and be like, all right, I don't know the answer, right? If you don't read this all the way through, you can miss this, even if it's an easy question, even if you know it's a gimme, right? So assessing the patient's respiratory status every 4 hours, taking vital signs and pulse ox readings every 4 hours, checking the ventilator settings to make sure that they are prescribed, or observing whether the patient's tube needs suctioning every 2 hours. B, all the way. All right, cool. So that's the thing. Some people are over here just like, yeah, these questions are easy. Bro, I didn't ask you if these questions were easy. Okay? Didn't ask you that. The whole point of getting into doing these questions is to become familiar of what the NCLEX may ask you and get into a routine. Like you'll never see no coach come up to me like, hey son, I want to put you in the game because, I think that you have what it takes. Coach, you know that I'm about to just get rocked when I try to run through this line, right? You know what I'm saying? So you have to practice. You have to practice and become familiar with any of these types of questions, even if they're easy. All right. So we got a lot of people saying B. B. What else? Got anyone? What else was it? Some people said C. Some people said D. Some people said B. A UAP cannot assess. That's what Avery says. Okay. Savage says D. B. Everything else is a nurse responsibility. B. I think D because of word experienced. Michelle says B. Fee says B. Okay. Shout out to all 241 of y'all up here. Rock with me. I appreciate y'all. Does it say Sadier? Did I say that right? Got B. B. Rashawn says B. Got D. Tarika says B. Ashley says B. Okay, shout out to y'all. All right, so we're going to get this answer. Y'all, here we go. What the hell, bro? Get it together, Kevin. Jesus Christ. We don't touch the settings or the meds, but we do vitals and observe them. Okay, let's see. Taking vitals and pulse ox readings every 4 hours. The nursing assistant's educational preparation includes measurement of vital signs, and experienced nursing assistants would know how to check oxygen saturation by pulse oximetry. The staff member's level of education, knowledge, past experience, skills, abilities, and competencies are also evaluated and matched with the needs of all of the patients in the group of patients that they will be cared for. Just like that. Period, boo. I'm sorry, I could know what's all that. Where your license? I don't know, Jamisha. Where is said license, ma'am? Where is said license? Where is said license? Shout out to all y'all. All right. Hey, the majority of you guys picked that answer, I believe. So, shout out to y'all. I don't matter. What you mean you don't matter? What you mean? What do you mean, though? What do you mean? Tell me what you mean. Is it Taylor? Laugh out loud. They just need to give this. Hey, look. Hey, go ahead to your board of nursing and let them know. Like, hey, bro. Hey, hand me that piece of paper with that number, cuz. Or it's on site. No, let me stop. Don't do that. Because they may lock your ass up. I'm just saying. I misunderstood the question. Nikki, so this is why I say it's very important that you who knows the term what RTFQ means? Because I, as a coach and as an instructor, I used to say this all the time, and I still say it. What does RTFQ mean? What'd I do? User 31. I know, I'm sorry. I'm out of pocket right now. I'm trying to get it under control. How do you read the ducking. Okay, I like that. I like how you said ducking, because if you say the wrong word, TikTok's going to give you a slap. Thank you so much for doing these lives. Look, Daisy, I do these Monday, Wednesdays, and Fridays at 5:30. Read the question. RTFQ, you already know what's up. Stop playing games with me. Psalms, you know what's up. Rochelle, oh, there go Rochelle, y'all. There she go. Oh, autocorrect. Well, autocorrect saved you from getting in trouble. All right, here we go. Question 13. You are caring for a patient with emphysema and respiratory failure who is receiving mechanical ventilation through an endotracheal tube. So paint the picture. To prevent ventilator-associated pneumonia, which action is most important to include in the care plan? Administer, order antibiotics as scheduled, hyperoxygenate the patient before suctioning, maintain the head of the bed at a 30 to 45 degree angle, or suction the airway when coarse crackles are audible. And I ain't talking about the books, even though I do got Audible. Shout out to Audible for all the books that I read because they Gucci around here. You know what I'm saying? The least, the most invasive. Got some C's, got some A's. It's quiet. Says it's C all the way, baby. I hear you, Sarah. I see you. Okay, Rashawn said C. All right, cool. Luna's mom. I'm guessing Luna is your dog. So Luna's mom says C. You said C. Who says C or A? Mika. You can. Hey, look. There can only be one. So you got to either pick A or C. Oops. Oh hell! I gave the answer. Oops. Always broad spectrum antibiotics. C. Mika says C. Okay. All right, I see it. Who saw the answer? It don't even matter. I'm about to just get the answer now. A. So it is C. Maintain the head of the bed 30 to 45 degrees. Research indicates that nursing actions such as maintaining the head of the bed at 30 to 45 degrees decreases the incidence of VAP. All right. These actions are part of the standard of care for patients who require mechanical ventilation, proper positioning, and encouraging early mobility and mechanical ventilated patients aid in the prevention of VAP, right? Period. What do you recommend studying for nursing school? You can really check out, Robbie, I'm going to need for y'all to put like some pleases, some smiley faces, when y'all start asking, can I get the answer? Because I'm just going to assume you're yelling at me, and I'm a sensitive individual. Yes, anatomy. Anatomy would be a good one. Hey, shout out to y'all for answering Brittany's question. All right. Hey, so by the way, if you guys ask questions in there and I don't answer them, hey, y'all jump up in there. UWorld worked great for me, so UWorld worked great for you. I did not like UWorld at all, and I used UWorld multiple times. However, UWorld does work great. It does have the stats to prove that they do well. So everybody says anatomy. Yep. Bio. Archer worked great too. Archer works great too. All right, here we go. Question 14. You are evaluating and assessing a patient with a diagnosis of chronic emphysema. The patient is receiving oxygen at a flow of 5 liters per minute by nasal cannula. Which finding concerns you immediately? So what is wrong? What is wrong? Patient with fine bibasilar crackles, respiratory rate of 8. I don't even know why I said that loud. Patient sitting up and leaning over the night table, or patient with a large barrel chest. B. Kayla says B. Alyssa says B. Kendall says B. Stacy says B. Is it Charlie or Carly says B? I think it's Carly. Mercilessly mercenary says, what'd you say? Said B. Somebody said C. Who said C up in here? Is it Selly? Seeley said C. Ashley said B. All right, cool. Ray says B. What a smiley face. Okay. Sarah, I see you. I see what you said. Hopefully B, but caught the moment. But all but B are expected findings. Okay. Because they go into respiratory depression. Tripod. Okay. So tripod, that would be C. That's what you said. All other 3 are symptom of emphysema. Okay. Tripod stance. Question mark. Maybe. So the answer is the respiratory rate of 8. Right? What is our normal respiratory rate in the patient? Think about that. What is the normal respiratory rate in a patient? Right? Yes, sir. There it is. For a patient with chronic emphysema, the stimulus to breathe is a low serum oxygen level. The patient's oxygen flow is too high and is causing a high serum oxygen level, which results in decreased respiratory rest. 14 to 20. 10. I was taught 10 to C. So here's the thing, right? Some literature will say, I've never seen it where it's 10. I've never seen it where it's 10 to 20. However, I'm not saying that it's wrong. I have seen 14 to 20 and I have seen 12 to 20. But we can all agree that 8 is not good. Right? And so this is the great thing about NCLEX. NCLEX will not put it super close. They're going to be like, hey, they have a respiratory rate of 21 or they have a respiratory rate of 11, right? But they will do a respiratory rate of like 8 or 7 because we all know that that's wrong. 8, was it under 8 intubate, right? Or how's it go? A GCS of 8, we intubate. Yeah, I see. I'm picking up what you're putting down, but exactly. Okay. So remember, with NCLEX, it's a standard. They essentially grab all these books, all this literature, and they pick between like, hey, These are the normal ranges. All right, now if we do something that's drastic, like we know that 25 for a respiratory rate is out of range, so we know that'll catch somebody's attention. Notice on earlier, it said it had a respiratory rate of like 38. We know that ain't good. We know that CO2 is probably just, so think about that. Okay, I like this page. Okay, Jamisha, I like you, girl. That's what I'm talking about. I'm taking notes. Hey, take notes. Take notes. All right, we're going to the next one. Here we go. 15. You are initiating a nursing care plan for a patient with pneumonia. Which intervention for cough enhancement should you delegate to a nursing assistant? And what did I say? Read them all the way through. Don't you stop. Read them all the way through. Will this help LPN school nursing students? Yes, it will. Because LPNs need to know what they can and cannot do, what they can and cannot accept, right? Teaching the patient about the importance of adequate fluid intake and hydration, assisting the patient to a sitting position with neck flexed, shoulders relaxed, and knees flexed, reminding the patient to use an incentive spirometer every 1 to 2 hours while awake, encouraging the patient to take deep breaths, hold it for 2 seconds, then cough 2 or 3 times in succession. We got C, okay? Look at the verbiage. There are key words like, hey, I don't know why I'm whispering, but look, teaching, assisting, reminding, encouraging. We're going to do some ASMR. So look at these. Look at all these right here. Okay. Look at that. Keywords. I love y'all. Shout out to all y'all. Give me the 30,000 likes. All right, that sounds kind of weird. Let me stop. Oh, you're stuck between. Okay, we got D. All right, cool. I hear you. I see you. Got D. Got B. Got C. Got B. Sabrina says C. You say B? Or you said C? Okay, I got you. All right, we got C. Got C. Got C. Okay, D. Free fall and relax. Look. D. Child. Girl. Look, I hear you. 1 to 2 hours. It's quiet, says B. C. Only answer not. Okay. I feel like it's C. Honestly, hey, go with your gut. Go with your gut. Is it oh, I'm gonna destroy that name. I'm not even gonna try it. I might just write it down and try to say it later. So all right, what we got? All right, we got B. I think it's C. All right, cool. Let's see what the answer is. The answer is C, reminding the patient to use an incentive spirometer every 1 to 2 hours while awake. A nursing assistant can remind the patient to perform actions that have already been part of their plan. Because who creates the plan? The RN. What does the nursing assistant do? They can reinforce/remind the patient what to do based off of the care plan that the nurse created, right? That was my gut feeling. That's okay. This is why this is here. This is what to learn that. What was it? I just told you. This one is BS. Look, hey, you may feel like it's BS, but I'm telling you, even while you're studying, you're going to feel like it's BS. You're going to be like, bro, fuck this. But I'm telling you right now, you got to keep going. Even if you don't agree with it, you got to keep going. The NCLEX is based off of a scale from 0 to 100 real quick, right? So you just have to do half. You just have to get 50% or above. What other exam you got to get a 50% or above to pass? Not nursing school, I know that. Not nursing school, I know that. I'm just saying, I always second guess myself. Ma'am, I'm going to need for you not to do that because the moment you second guess yourself, you're going to get the question wrong. Okay? I'm just telling you. All right? So, I should have read that whole thing, but you guys understand what I'm talking about. All right? So, I missed it, but what was the answer? The answer is right there in front of you, Alyssa. It says C. 92 or above for us in school. Lord of mercy. Fact about second guessing. I'm going back for RN. So this is great. Shout out to you, Heather. I'm glad that you're here. So once every 1 to 2 hours. No, it's just based off. Yeah, that's what it was. It's C right here. There it is. Is it too tiny? Is it tiny? I'm sorry. I ain't nothing I can do about that right now. If y'all got me, if there was 10,000 people that like me, then y'all would be able to see the whole thing. But apparently 10,000 people don't like me and don't want to follow me. Okay, next question. All right, here we go. Oh, look at that. So we're about a little more than halfway through. So shout out to all 270 y'all being here. We're doing NCLEX style questions or NCLEX questions, whatever you want to call it. I don't gatekeep. I got these questions off nurseslabs.com. So if you're a nursing student, if you want to look up stuff over there or anybody, go over there and check it out. That's number one. Number two, also check out their questions and what was the look at NANDAs. Like if you're trying to do the nursing diagnosis, they got all the nursing care plans you could ever want that could help you figure out what you need to write when you're in clinicals or when you're in nursing school, especially when you're getting fundamentals. All right. So of course, participate. I'm kind of, sort of, not really, but really funny. I'm really, really funny. Ask Rochelle. Stop playing games with me. Okay. The more you like, the more question that you get. I wanted 25,000 likes. Y'all literally just got me to 32,000 likes. So I love each and every one of y'all. and I appreciate everybody that's here. And I'm glad that everybody likes this. Ma'am, I'm a repeat test taker. I'm about to tell y'all about that as well. Also, I'm talking about the 7-day NCLEX course. So if you're a new student about to start school, or you're already in school and you're looking to get a jump start on your NCLEX journey now, check out the 7-day NCLEX course. That link is in my bio. It's in a pre-launch phase, which means I am uploading content. I've heard everybody's concerns and the feedback, and I am currently working on my NCLEX review as well as questions and answers for the new generation NCLEX. So all that stuff is coming up within the next couple of weeks. So, but hey, it's $48. Once you get this NCLEX review that I have, you have it forever. I just sent out a big email to all 100 students that are in my program right now, and I got some feedback and some replies back, and they appreciate it. And so, hey, y'all are helping me build this plane as it is in the air. So we're kind of like Spirit, but y'all love me more. You know what I'm saying? And we ain't got all this turbulence going on. You know what I'm saying? So that's what we're doing. All right. Also, don't troll my chat. You act a fool in my chat, you're getting a 600. I promise you. And the 600 means I'm going to ban you straight up. Okay. And I like to troll. Is this the new NCLEX style question? So these questions are essentially kind of the older questions. So 2 things I'm going to say. 2. The NCLEX has not gotten rid of the original type of questions. There are still priority questions. There's still the multiple choice. There's still select all that apply, the drop downs, the orders, all that good stuff. All of them are still there. They have just added additional question types into the exam itself, such as, multiple responses, fill in the blank type questions with drop down chooses. What else? And of course, the case studies, which you can get anywhere between 6 to 8 questions per case study. I like the case studies because they give you everything that you need. Everything, right? Everything from patient history to the vital signs to, the labs, the trends, all that stuff, right? So new generation NCLEX questions are coming, all right? But this is just to get you familiar, get you into NCLEX testing mode, all right? Some people are saying these questions are easy. Some people are saying these questions are hard. So it all just depends on who you are and how you feel. If you guys don't know a little bit about me, my name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go check me out on YouTube, Instagram, Thread. I think that's how you do it. Or X. X gonna give it to you, right? Make sure you guys check me out over there. If you know anybody that needs this type of stuff, I upload these videos to my YouTube. And so it's going to be on YouTube for anybody that may need it. Okay. So also, and for those that don't know, if you want to know my credentials, because I've never been asked that question before, I have been a nurse for 3.5 years. I've worked in an ICU, I've worked in PACU, and I've worked in the OR. I've been an educator for 8 years. I've been coaching for 3.5 years, ever since I got my license. Also, I failed my NCLEX 3 times. 3 times. No one in here would have known that unless I just told you that, right? And I created this, and I wanted to do this because I never want anybody to feel how I felt. All right. So that's why I do this. All right. I love y'all. I appreciate y'all. We're going to go on to the next one. All right. Cool. Here we go. All right. Question 16. You are making a home visit to a 50-year-old patient who was recently hospitalized with a left leg deep vein thrombosis and pulmonary embolism. The patient's only medication is enoxaparin, aka Lovenox, subcutaneously. Which assessment information will you need to communicate to the physician? Right. So what is happening that you need to communicate to the doctor? Like, hey, I need to bring this to your attention type deal. Okay. So we got C. I'm a home visit nurse. Look at you. Maribeth, look at you. Krista says C. All right. So we have a patient says that says that her right leg aches at night. Right calf is warm to the touch and is larger than the other calf. Patient is unable to remember her husband's first name. Or multiple ecchymotic areas on the patient's arms. So what do we got? B, CVA. Okay. Somebody says CVA. We got B. Precious says B. Mercilessly says B. TikTok says LOL. I don't know if LOL is on there, but okay. Okay, y'all are going way too fast. So I'm gonna just wait to see what y'all got. Alyssa says B. Okay. Is it Mel C? Says C. Rochelle says C. There go Rochelle saying something, you know what I'm saying? Make sure you guys share. Make sure you guys like. I appreciate y'all. Kayla says B. What is ecchymotic? Somebody tell Trashy. I'm trash or they're trash. Somebody tell them what that is. B is like unremarkable DBT. What's the answer? I'm gonna need for y'all to ask me what's the answer with like a smiley face because I'm assuming that you're yelling at me. Okay. It's bruises. There you go. It's bruises. There you go. Tell. Okay. Bruises. Bruce says, it's a Bruce. It's a knife. No, let me stop. All right, here we go. Here goes the answer. There we go, Heather. Shout out to you. I appreciate the hug and the slap. Y'all love me, yo. I appreciate it. Here we go. The answer is the patient is unable to remember the patient's or the husband's first name. Confusion in the patient this age is unusual and may be an indication of an intracerebral bleeding associated with enoxaparin use, right? So what is enoxaparin? What does it do? First of all, what type of medication is it? And what does it do? Yeah, it's a bleeding issue. What? I know. It is. What you mean? Nah, come on now. Wait. Right? Where's the question? There you go. Okay. It says because of the reduced effectiveness of the antibiotic, bleeding complications can be severe and life-threatening. Anti-coag. I got it right. See, you're imperfect. And you got it right perfectly. There you go. Can I see the question again? Kayla, man, we ain't going back for you. Okay. But there you go. Oh my God. Okay. Rationale. How many questions have you done so far? This is question 16 and we're doing 25 because apparently y'all love me and y'all like to share. Hey, I'm letting y'all know this is the best TikTok live I have done so far in the last, since I've been doing it, I think since like March. This is the best TikTok live I've done. Y'all are rocking with me. We are building the plane. Spirit Airlines, better than Spirit Airlines, is going down, losing altitude. You know what I'm saying? I appreciate y'all. 50-year-old. Yeah. Okay. Thanks. Okay. All right. Cool. Thank you. You're welcome. I got you. All right. On to the next. You are providing care for a patient with recently diagnosed asthma. Okay. Asthma. What is it? Think about it, right? Which key point would you be sure to include in your teaching plan to this patient? Select all that apply. You know, this is the questions that I know y'all love, man. I know y'all love them all. Daisy, you appreciate? Daisy, I appreciate you. I appreciate you for being here. Hey, what we got? I got to select all that apply. So I know y'all are scrambling like, bro, like, I don't even know what the fucking answer is. Super says ABC. Sarah says BCE. Before Christ. Let me stop. ABC. Why everybody lowercase in the C? What's wrong with y'all? Kayla says ABC. Okay. Sarah says ABD. Like abdominal. Oh, I'm just playing. AB. Antonio Brown. All right, cool. ABC, Kayla. ABCD, Elizabeth. Can I call you Liz? I'm calling you Liz. Liz Beth. ABE. Abe, like honest Abe, like Abraham Lincoln. ABD, okay. As told by what? What is your name? As told by what? Oh, hell, I done missed it already. Don't even matter. ABCD, okay. It's quiet. It says ABC. All right, cool. Ace. Krista says Ace. Okay, ABCD. Okay, we're going with the alphabet. Okay, I got you. All right, we ready for the answer? Here we go. I think we got enough. I think we got a general consensus. Everybody's got their turn. Come on, answer. All right, here we go. It's like we playing dice, you know, like or whatever. Here we go. The answer is A, B, D, and E. There we go. Asthma comprises of a range of diseases and has a variety of heterogeneous phenotypes. The recognized factors that are associated with asthma are a genetic predisposition, specifically a personal or family history of they got these allergies, eczema, hay fever, and asthma. So you got any family members that got that, you probably got it. Most of y'all probably got eczema to get asthma. Okay, I'm just letting y'all know that right now. Never heard of asthma in the NSG. I'm not even gonna lie to you. I didn't either. Now you do. Hey, listen, did you know that if you have a family history of allergies, eczema, or hay fever, or asthma, that you can end up getting it? Now you do. Hot duh. The little words. There it is. Sometimes one word can change the entire thing, okay? Learning something new every day. That's what I like to hear. We learn new things every day. And I appreciate everybody's learning. Shout out to all 157 of y'all. And make sure you guys share, like, and follow me because, you know, I'm kind of a cool dude sometimes. Sometimes. Here we go. Question 18. You are providing care for a newborn infant with respiratory distress syndrome who is receiving nasal CPAP ventilation. What complications should you monitor for this infant? Pulmonary embolism, I got bronchitis, pneumothorax or pneumonia. Oh my God. I'm sorry. I got bronchitis. Got some C. Got C's all the way. Got C's all the way. Okay. Well, no shoes or nothing, Jesus. I have no clue. That's fair. Well, give us a guess, Avery. Give us a guess. No surfactant. I mean, is your name Alonica? Man, y'all got some good names out here. I'm just saying. No surfactant. No, ma'am. Terica says C. Okay. Okay, Alonica. No, Alonica. All right, I'm sorry. I couldn't help myself. I always try. Anybody that's name that's like Monica or has that like that last part, I always do that part from Fast and the Furious. Before birth, everyone's saying C, but my first bet is D. Okay, if that's what you want to go for it. We're gonna find out what the answer is anyway. Imperfect Nurse says D. Co says D. All right, cool. We're gonna answer this question in 3, 2. The answer is C, a pneumothorax. Oh, Honey said C. I see what you did there. I was just like, that ain't it. That ain't it. Well, ma'am, it's all good. No, don't, hey, don't cry. It's all good around here. Jamisha, ma'am. Oh, hey, Jamisha, you own it tonight. The most common complication after birth for an infant with RSD is a pneumothorax. Alveoli rupture and air leaks into the chest and compresses the lungs, which makes breathing difficult. Pulmonary air leak syndrome, such as pneumothorax and pneumomediastinum, may also present as respiratory distress, but the onset of symptoms may be more acute. Remember, babies decompensate extremely fast, and it doesn't take a lot. It doesn't take a lot of anything for a baby to just be like, oh, pneumothorax. It doesn't take a lot at all. Yeah, CPAP can cause pneumothorax, right? Just joined, but third time, oh God, right? Jonah, look, I don't know what happened. But whatever has happened today, they loving it. So, and I love them because they love me. All right, on the next one. All right, here we go. Question 19. You are responsible for the care of a post-operative patient with a thoracotomy. The patient has been given a nursing diagnosis of activity intolerance. Which action should you delegate to the nursing assistant? Right? Instructing the patient to alter rest and activity periods, encouraging monitoring and reporting nutritional intake, monitoring a cardiorespiratory response to activity, plan activities for periods when the patient has the most energy. What are we doing? 33. What does 33 mean? Is that like a heart and 3, I'm assuming? Wait, I missed it. How many questions have we done? Ma'am, we're on 19 questions. That's how many questions. Taylor, boo, where you been at? All right, we got A. Hey, so what is the last part of that question? Which action should you delegate to the nursing assistant? All right, we got B. I'm going to say B. All right, apparently, Jamisha is like the student of the night right now because she on it. So she's like, period. So, I mean, there's not a T at the end of that. So I'm glad that we have good, we can spell. So I appreciate you. But hey, that's where we at. That's where we at right now. All right. So no. Too much pressure. Too much. Hey, too late. You came up in here. So, hey, I just want to let you know that you either going to get the finger or I'm going to talk about you, or you're getting both. I'm just saying. Either that, Jamisha, or you get a 600. Which one you want? I'm just playing. I'm not going to give you a 600. You've been participating, so I appreciate that. Here we go. It's A. Can't instruct or assess. I'm a pre-nursing student. These are so interesting to watch. Well, I'm glad that you're here. We're going to do these. I do these all the time, 3 times a week, Monday, Wednesday, Friday at 17:30 Central Standard Time, aka Texas time. Not in El Paso though, because they're on Mountain Time, but y'all know what I'm talking about. So here we go. In 3, 2, let's see. It's B, encouraging monitoring and recording nutritional intake. A nursing assistant's training includes how to monitor and record intake and output. After the nurse has taught the patient about the importance of adequate nutrition intake for energy, the nursing assistant can remind and encourage the patient to take in adequate nutrition. Notice how it says after the nurse has taught the patient. After. Encouraging, monitoring, and recording. That's what a CNA can do. That's what a UAP can do. Oh, there goes the T. Oh, somebody said period. Or why shouldn't it be D? Well, let's find out why. It says, so here's the scope of practice right here. Oh, I'm sorry. Here's the answer right here for D. It says the scope of practice for the registered nurse will most likely include the legal ability of the registered professional nurse to perform all phases of the nursing process, including assessment, nursing diagnosis, planning, implementation, and evaluation. So D, let me go back. Where we at D, it says planning activity. That's why. Add pie. All right. I think we're good on that one. Let's move on to the next. All right, question 20. You are supervising a nursing student who is providing care for a patient with thoracotomy with a chest tube. So let's paint a picture. Paint the picture, right? What findings would you clearly instruct the nursing student to notify you about immediately? So I'm going to tell the nursing student, hey, if you see this, you need to come and tell me. So sometimes when these questions are worded like this, put them in a way that you can understand them. But don't put them in a way to where, you completely miss the question, because then you're going to get the question wrong. Then you're going to be like, oh my God, Kevin told me to do that and I got it wrong. And I'm like, I ain't tell you to do that. Chest tube drainage, 1 to 10 mLs an hour. Continuous bubbling in the water seal chamber. Complaint of pain at the chest tube site, or chest tube dressing, or the chest tube dressing dated yesterday. We says C. Rochelle says B. 1,000%. Hey, you sure about that? You sure about that? You sure about that? Okay. All right, here we go. Continuous bubbling isn't normal. That's what Kelly says. 1,000%. Okay, Rochelle. Rochelle only pop up in here when she knows she get the answers right. That's what I noticed. How you gonna pop out, be gone, and be like, hey, I know the answer. I'm still here. Oh, hey, what up? See, look, you laughing because you know I'm telling the truth. I say B, but I don't know. Okay, Taylor, okay. Should be titling. Hey, don't be throwing that in there. Who is that? Krista, don't be throwing that in there. Don't be talking about titling. It's not talking about titling. All right, don't throw in anything extra. Look at what they are asking you. Don't throw in no more and no less. All right, because you start throwing in more, you could possibly get the question wrong, right? Isn't the seal supposed to be bubbling? It's C. Bella says C. Okay. Continuous bubbling isn't normal. That's what Pixie says. What kind of test tube? What? What kind of test tube? What you mean? I say test tube or chest tube? I said chest tube. Says B. Okay. All right. Shout out to all 247 of y'all. Not C, but I'm not sure. B for air leak. Okay. We got C. Well, let us find out what the answer is. The answer is B. Continuous bubbling in the water seal chamber is a no. Right? Continuous bubbling indicates an air leak that must be identified. With the physician's orders, you can apply a padded clamp to the drainage tube close to the occlusive dressing. If the bubbling stops, the air leak may be at the chest tube insertion, which will require you to notify the physician. If the air bubble does not stop when you apply the padded clamp, the air leak is between the clamp and the drainage system, and you must assess the system carefully to locate the leak. Baby, I done failed. And what you mean? You ain't failed the NCLEX. You ain't even take it yet. Well, I don't know if you say you haven't taken it yet, but you look. Hey, don't let these discourage you. This is what we're supposed to do. This is practice, y'all. This is practice. I don't miss the NCLEX. Good luck, y'all. Look, look. Shout out to all 215 of y'all. I've taken the NCLEX 3 times, and let me tell you something right now. Those unsuccessful attempts and those failures made me the person I am today. It made me focus on being a way better nurse and letting that test determine what type of person I am. And it brought me here. I'm pointing at myself, but I'm also pointing at y'all. I'm just being all the way. I got to retake it again. That's was it Adriana? That's okay. That's okay if you got to take it again. You know what I'm saying? Because it's not gonna look. Y'all see this right here? Y'all see that? Look at that date. Right? That's when I failed it. Y'all see my name? That's when I failed it. Look. That's one of the failures. This is one of 3. Right? 1 of 3. Right? Don't be scared of it. All right? Here we go. Oh, look at that. We're at a little break. All right, cool. So, hey, we're doing NCLEX style questions or just doing NCLEX questions. I appreciate all of y'all being here. If you have never been here before, or if you're new to life, first of all, I need for you to follow me and I need for you to like me and just be my friend because I'm kind of sort of cool or whatever. Hey, participate in these questions, okay? Because your participation just makes me be more active with y'all on top of y'all being more active with me and, kind of like being my friend. You know what I'm saying? Like, because, TikTok makes friends and steals your privacy data. And listen, okay? Now you do. Now you know. What is the 600? Cat, I'm glad you asked. I'm going to get there, though. But anyways, hey, like I said, my name is Kevin. I go by The Boot Nurse. Make sure you guys follow me on YouTube, Instagram, of course, here on TikTok, Thread, X, OnlyFans. No, I'm just playing. I ain't got one of them. Or do I? Anyways, so I need for all y'all to follow me. Make sure you guys go over all those places, check that out. If you know somebody who needs this, this type of thing that I got going on right here, if they miss it, it's going to be on my YouTube channel. So I want everybody to go over there and subscribe, okay? So make sure you guys go over there and subscribe. Hey, the more you like, the more questions you get. Y'all got me to 37,000 likes, and there's 25 questions, and we're at question 20. So guess what that means? Y'all about to get all 25, okay? So y'all already dished it out. So now I got to give it back. You know what I'm saying? So, those that are on their NCLEX journey, if you're going to be taking your NCLEX here in the next year, 2 years, 6 months or whatever, check out the 7-day NCLEX course. That course is going for $48, which is 80% off of the current price. Once you get it forever. It's in its pre-launch phase and we are growing. We got 100 students over there. I got 100 people that are in there that are a part of the growth process. And I appreciate all y'all and everybody that at least considers it, shares it, is a part of it. Love it all, right? So, hey, for $48, once you get it forever. You get all the updates to include the NCLEX prep that I'm putting in there and NCLEX style questions that I'm getting made to put up in there, all that good stuff. So, there's that. Troll in my chat, I'm going to troll you, aka I'm going to roast you, and then I'm going to give you a 600. It was a cat who asked, what is a 600, you may ask? So, a 600 it means 600 seconds. 600 seconds means it equals to 10 minutes. 10 minutes is how long I'm going to ban you if you come in my chat trolling. And when I ban you, I don't ban you for 10 minutes. I just ban you forever. I just like saying 600 because people are just like, what's 600? That's what a 600 is. AKA, you're going to ban world and you're going to be there forever. So you come in my chat and troll, I'm going to troll you. Then I'm going to roast you and then I'm kicking that ass out. So don't be coming over here acting a fool. All right. Another thing I don't do, I don't coddle. All right. If you come in here with a problem, you better come in here with a solution. I'm just keeping it real. All right. Because I'm all about helping everybody. I love to help people. I love to teach. But if you come in here with a problem, you better come in here with a solution. And that's on the dead homies. You feel me? All right. On to the next one. Hey, question 21. You were supervising a student nurse who was performing tracheostomy care for a patient. Paint the picture, okay? For which action by the student should you intervene? AKA, what is the student doing that is wrong that you need to jump in to do? Okay, you as the nurse. Rochelle says C. So A says suctioning the tracheostomy tube before performing tracheostomy care. Removing old bandages and cleaning off excessive secretion. Removing the inner cannula and cleaning using universal precautions. Replacing the inner cannula and cleaning the stomach, or changing the soiled tracheostomy ties and securing the tube in place. Everybody says C. Notice how this does not say select all that apply. It does. You're just picking one answer, right? So what do we got? Sterility, universal precautions. I know, super TikTok 20s or TikToks 20s. Look, sir, ma'am, or whatever you identify as. I'm just keeping it all the way 100. Universal precautions, right? I'm just saying, hey, I don't gatekeep, by the way. I'm just letting you know I got all these questions off of nurseslabs.com. And that not only do they have like helpful questions that are over there, but if you're a nursing student in nursing school, they have a lot of other good, helpful things that are over there, such as if you need help with your nursing diagnosis while you're in fundamentals and while you're going through the rest of your nursing school, right? Look at those as well, all right? So the general consensus, I got some A's, I got some C's. I've seen more C's than anything. So we're going to go ahead and answer this question in 3, 2. The answer is C, removing the inner cannula and cleaning using universal precautions. When tracheostomy care is performed, a sterile field is set up and sterile technique is used. Sterile technique is used. Why? Because you are going directly, like the protective barrier to get into the trachea is gone. So it needs to be a sterile process to prevent any type of icks from getting in there. And by icks, I ain't talking about, like what icks you. It's about all the icks that are around the hospital and all the nastiness that's just floating out there in the world, okay? What would be the sterile procedure? So essentially, there's a trach kit that you use that you have to change the inner cannula, And it comes with sterile gloves and all that other good jazz. So you learn about how to do trach care in nursing school from last time I remember, because we did it in nursing school. On top of, you will learn it when you get to your unit as well, because it's part of all of the checkoffs when you get in precepted, or if you're in a residency program, or both. Okay, so the answer is C. Standard precautions such as washing hands must be also maintained, but are not enough when performing tracheostomy care. Right? You got to think about, what are those sterile procedures that you can do. Never turn your back to your sterile field. Also, for those that don't know, I'm also still a certified surgical assistant, and I have been for the past 13 years. And you never turn your back to a sterile field, because I have no idea what is going to happen for the 5 seconds that my back is turned to it. Okay, so you got to maintain the sterility, right? Have you seen the TikTok of? Nope, I haven't seen that. All right, here we go. 22. You are supervising an RN. Oh, this is a good one. You are supervising an RN who was pulled from the medical surgical floor to the emergency department. Now, you're pulling a nurse from one floor to another, right? The nurse is providing care for a patient admitted with anterior epistaxis, or epistaxis, which is a nosebleed. Oh my God, obviously I don't know how to talk. Which of these directions would you clearly prove to the RN? Select all that apply. Shout out to Nurse Nelly. Nurse Nelly is back. That's my co-host. 4-year nurse, been in med-surg, done tele, ICU for a little bit, as well as does case management, loving her life out here. Nurse Nelly, girl, do you see all these likes that we got on here? Do you see all these likes? My goodness, they out here loving. All right, so what is it? A, position the patient supine and turn to his side. B, apply direct lateral pressure to the bleed for 5 minutes. C, maintain universal body precaution or substance precautions. Apply ice or cool compression to the nose, or instruct the patient not to blow the nose for several hours. You got ACE, ABC, or ACDE. Avery said BCE. All right, cool. I'm tracking. BCE, BCE, BCDE. Okay. Let's see. BCD. Okay. All right, cool. Shout out for Tina for the follow. I'm going to start shouting y'all out for following. This question is too much. What you mean this question is too much? You said all the other questions were too hard or too easy earlier. Now it's too much. Hey, listen, did you know that you're going to get select all apply questions when you take your NCLEX, and they're going to be just as hard? Now you do. AD, active duty. Oh, Seda, I don't pick what I don't know. Exactly. On Seda, if you don't know, don't pick it. Anytime. Hey, if you guys are ever taking a select all that apply question test or whatever, I want you to listen to just my voice. I want you to listen to it. And I'm going to say, hey, if you can't 100% tell me why this answer is part of this question, you better not pick it. And you better not ever change your answer unless you can 100% say to me with certainty that the answer that you're picking outweighs the one that you had originally picked. Right? Hey, by the way, on my NCLEX, I got 9 select all apply questions. Once again, it all just depends on you. All right, here we go. Answers in 3, 2. The answer is B, C, D, and E, right? Epistaxis is relatively common but rarely fatal. Anterior bleeding is usually managed by digital pressure, gentle chemical cauterization, or nasal packing. Posterior bleeding, which is less common, is characterized by massive bleeding that is initially bilateral. This bleeding may be more difficult to control. I was correct. Shout out to you. You got 3 out of the 4. Hey, so you got to know, like, a lot of these select all that apply questions now, they are partial credit. They are partial credit. Okay. What was the question? Okay, I need to know the rationale behind D. All right, let's see. I'll read it right here. So the rationale behind D, it says, cooling the nape of the neck is said to induce reflex constriction of the mucosal vessels of the nose, but there is no general agreement in the literature on the benefit of an ice pack as an adjunct treatment of epistaxis. So, according to literature, it says that putting it on the neck is said to induce the constriction of the mucosal vessels, but it says there's no literature that says that. There's no literature that says that there's constriction of blood vessels if you put an ice pack on somebody's nose. What? Look. I don't know. I'm just a messenger, yo. I'm just a messenger. I don't write the books, although I should write books. I think I'm gonna write a book. Hey, if I write a book, which I'll buy it. That's just a general question. I'm just, I'm just, I'm just, I'm just asking. I'm asking. You know what I'm saying? If I wrote a book, would y'all buy it? ATI says I is for epistaxis as evidence-based practice. Hey, I'm just letting you know, I don't like ATI. But if that's what ATI, hey, I'm telling you, if ATI told you that as evidence-based practice, and you get a question that's like that on your exam, right? On your exam in school, you better pick that answer based off of that literature because it's a part of what ATI has created. Okay? I'm just saying. Honey said you might. Honey, you said, honey, you trying to tell me that if I wrote a book, you might buy it? 600. I'm just playing. You're not getting 600. How often have you seen ice packs for noses for no? Honestly, never. Me, honestly, I have never seen that. All right, question 23. Honey, you ain't getting no 600. I'm just playing. 2,000? What you mean? You want a 2,000? Okay. All right, so question 23. You are a preceptor for an RN who is undergoing orientation to the intensive care unit. All right, you're going to the ICU. The RN is providing care for a patient with ARDS. Tell me what ARDS is. Who has just been intubated in preparation for mechanical ventilation. You observe the nurse perform all of these actions. Which action must you intervene in immediately? So what action is the nurse doing that you need to intervene on? Meaning they're doing something wrong. Excuse me. They're doing something wrong. Okay. So A, assessing for bilateral breath sounds and symmetrical chest movement. B, auscultating over the stomach to rule out esophageal intubation. C, marking the tube 1 centimeter from where it touches the incisor teeth or incisor tooth or nares. Or D, ordering a chest x-ray to verify that tube placement is correct. Some people say D. The super says D. Got C, C, C. Emily. Emily is Emily. I got you. All right. Super says D. They stopped doing B, right? What you mean? I don't know. What you mean? They stopped doing B? What? What you mean? Nurses can't order? What you mean nurses can't order? What? What are you talking about? Hey, remember on NCLEX, you have the order. The order's already there. You have everything that you have, all the hands that you need. You have all the people that you need. You have the order. You have all the equipment. Okay? Think about that. Because remember, NCLEX is perfect world. Perfect world out here. Oh, right. Yeah. In my 3rd year of medical school in the U.S. Hold on, I want to see that. And don't know the answer to this. Hey, Ashley, that's okay. Ashley. Hey, you know, honestly, that's probably like one of my favorite songs by DaBaby. You know what I'm saying? Ashley. All right, I'm done. I'm sorry. I'm done with the nonsense. That's okay if you don't know it. Everything is a learning process, right? Everything is a learning process. All right. I think everybody's gotten a chance to order this. Somebody says I'm going to order, and I said order. Is B old school? No, it is not. It is still done. All right, here we go. In 3, 2. It is C, marking the tube 1 centimeter from where it touches the incisor tooth or nares. All right. Here we go. I know some people are just like, whoa, why? Cries. That's okay. Hey, this is why we do these, so you can know why the answer is correct. The endotracheal tube should be marked at the level where it touches the incisor or nares, right? This mark is usually to verify that the tube has not shifted. If the patient has an endotracheal tube, check for tube spillage into the right mainstem bronchus, as well as invertented extubation, meaning like if it's not all the way inside of the trachea, which you'll know if it's inside the trachea. So to answer your question about B, I think it was for B where we were asking. So like in practice in the hospital, they do still check the epigastric. But then you're gonna know if it's in the epigastric because you're gonna know, hey, it's not in the trachea, it's in the esophagus, so I know I'm in the stomach. If that makes sense. Because I know somebody had asked that, right? Why would you mark it before confirming it? That does not make sense. I wish I could answer that question. But actually, so let's see. So you can mark it because here's the thing: is just like you'll mark it because you'll mark it where the teeth's at. X-ray is already going to be there for intubation for the intubation anyway, right? But I'm not just going to leave it there without it being secured because if it's not secured, it'll move. And plus, it'll let you know how far down it is. It'll be like, hey, 22 centimeters at the teeth, right? Not like 22, not 1 centimeter away from the teeth. You want to know exactly where it's at, because if it comes out, then you know, hey, it's 18 at the teeth. Well, I'm like, damn, it came out 4 centimeters. Is it even in the trachea now? You know what I mean? That's what I'm saying. All right, here we go. I know that one was a little bit difficult. Yeah, no problem, Molly. But I know that one's a little bit difficult. I had to really think about that one, just for the simple fact that in reality, when you're doing intubation placement, you know, there's going to be a bunch of people in there, you, the doctor, and probably one or two other people, usually. An X-ray will be there to confirm placement. However, when they get intubated, they're going to intubate them and they're going to mark it at the teeth. Respiratory will be there and all that other good stuff, right? But then you got to make sure that it's where and it's secured where it's supposed to be. There is a lot that can happen in a rapid intubation. Yeah, 100%. 100%. All right, here we go. Question 24. You have just finished assisting the physician with a thoracentesis for a patient with recurrent left pleural effusion caused by lung cancer. The thoracentesis removed 1,800 milliliters of fluid. Which patient assessment information is important to report to the physician? Now, paint a picture. What is a thoracentesis? Right? So if we do our medical terminology, thora, right? And then centesis, right? Where is this located? And then what is this doing? Right? And so we're removing fluid from the thoracic cavity, right? So it says, what do we want? What is the important thing that we need to tell the doctor? The patient starts crying and says she can't go on with treatment any longer. Patient complains of sharp stabbing chest pain with each deep breath. The patient's blood pressure is 100/48 and her heart rate is 102. The patient's dressing for the thoracentesis site has 1 centimeter of bloody drainage. So I see a lot of C's. Ashley says B. Okay, third year med student, tell us what's up. So here's the thing about med students and nursing students. It's like when you're a med student, you're learning about everything that is involved with the medical aspect of a patient. You know? And so it's just like, as a medical student, you're not even thinking about necessarily, you're going to be thinking about like what they're going to be telling you versus like somebody that's a nurse. I need to know like what are the assessment objectives that I need to be able to tell you as a doctor. C, I think, but also B, blah, blah, blah. Okay, I got you. The little blood is normal. Okay. If you're a nurse and you need to tell me if you're a nurse and you need to tell me something, is dramatically wrong, like B. I think B. Okay, Rochelle. Where Rochelle at? Rochelle ain't say nothing? Oh, she been hitting on him? Okay, I think C because it gives an abnormal vital. Okay. Okay, B. Some people say B. All right. So remember that the patient you just finished, they just had a thoracentesis. So think about what are some expected outcomes, right? So we're saying C. Some people are saying C. Some people are saying B. All right, cool. Too much fluid can send you into shock. Okay. I like where your head's at, Gabriel. Sepsis could be, right? They are tacky. Where does it say that? It does say that right there. Like, where does it say that? I don't see no math. Okay, I see it. 102. Shout out to you. No shout out to me because obviously I don't know what I'm looking at, right? Ashley says probably C. Ma'am, Miss Med student, I'm going to need for you to come to me with a definitive answer. Give me something. Barely tacky, but still tacky, right? Slightly tacky, right? Shout out to you, Victoria, for the follow. I appreciate you. Know I said B, but possibly C. Ma'am, okay? Look, all right? Killing me. You're killing me right now. All right, so I'm going to give you guys the answer. Ready? Here we go. In 3, 2, 1. The answer is C. C's get degrees. Hey, what do you guys call a doctor that got, that was last in their class and that got C's? Ashley Moore. I'm just playing. I'm just kidding. I'm just picking on you. All right, so here we go. Didn't see this coming. That's okay. Badge, baby. A doctor, shout out. That's what we call it. Hey, Ashley, I'm just playing with you. Please don't yell at me. Okay, there you go. That's what I'm talking about. All right, so removal of large quantity of fluid from the pleural space can cause fluid to shift from circulation into the pleural space, causing hypotension and tachycardia. The patient may need to receive IV fluids to correct this. There we go. C got me kicked out of nursing school. Good God, Meredith, ma'am. Meredith. Every time I hear Meredith, it just reminds me of The Office. But I mean, I know that ain't you. So I think any nursing school I don't think any nursing school allows a 70. What do you mean? Like my nursing school, like you had to stay above a 75. C make me graduate. Okay. In real world, the doctor would what? Would be annoyed and say the map is fine. Of course they would. But Bubbles, oh, here goes Bubbles. Powerpuff Girl is up in here. All right, but you're right. There it is. Where do you work? I work in a hospital. Caitlin. Oh, wow. Mine was a 78. Yup. So it all just depends. All right, so here we go. Everybody got a good understanding of that. 76 for us. All right, cool. Shout out to y'all. Shout out to y'all. Oh, I worked in the operating room, Caitlin. I used to work in the ICU, then I worked in PACU, and now I work in the OR. Shout out to MedSurg. Hey, I'm not even gonna lie to you. I like going to the med. Like I was helping out with infection prevention or quality care, and I went to MedSurg all the time. I like hanging out in MedSurg. Those were cool people over there. Damn, good work. Hey, that's what I'm saying. Hey, shout out to all y'all. Hey, we're on question 25, and y'all got me 41,000 likes. Look at that. I appreciate y'all. Hey, here we go. Last one. Question 25. You have obtained the following assessment information about a 3-year-old who has just returned to the pediatric unit after having a tonsillectomy. Which finding requires the most immediate follow-up? Frequent swallowing, hypotonic bowel sounds, complaint of a sore throat, or a heart rate of 112. Okay. A. Patient may be bleeding. A. Could be blood. It could. It's some blood issues. I'm sorry. Sahar, thank you for the follow. I appreciate you. There it is. The rest are expected. Okay. All right. Ashley, you better not hum. You better not hum at all. You better get this answer right. You better get it right. What is hypotonic bowel sound or hypotonic bowel sounds? Honestly, I don't think it's hypotonic, but no bowel sounds. Hypo meaning low, tonic. I'm assuming movement. I can't even remember, to be honest. I ain't even gonna lie to you. And somebody asked me earlier if I was tired. Yes, I am tired. I do a lot of talking like this all the time, so I'm tired. Hypoactive. There you go. That was the word. Honey said, hey. Does it mean hypoactive? It does. Thank you. You're welcome. All right, here we go. You guys ready for this last answer? I'm about to give it to you. I'm finna give it to you right now. Here we go. In 3, 2, 1. Listen, did you guys know? No, I'm just playing. Here we go. All right, so the answer is frequent swallowing. Frequent swallowing after a tonsillectomy indicates bleeding, just like you guys hit it right on the head, right? You should inspect the back of the throat for evidence of bleeding. The other assessment results are not unusual in a 3-year-old after surgery because all of those are expected, right? And yes, I'm in hypoactive. I don't know why I said hypotonic. I think that was dumb. Possible hemorrhage. All right, that is the last question, ladies and gentlemen. Boom. Oh, man, look, we did it. Yeah. All right, I'm just going to go ahead and excuse myself. I'm not even going to lie to you. That was embarrassing. All right, hey, so we did it. I thank you for participating. I told y'all I'm kind of funny. It's kind of, sort of, but not really. You liked, so you got more questions. So I appreciate y'all. Y'all dished out 25,000 likes. Y'all gave me 41.6 thousand likes. I'm just saying. Y'all just gave me all those likes. I'm just saying. Oh. And I appreciate all. Hey, I love everybody that was here. I love everybody that shared. This is the most shares. This is the most likes that I've gotten. So I really, really appreciate it. You're asking for 30 questions? No, you got 25 questions. What you mean? What time tomorrow? Man, look, I'm only one person and I can't be doing all that. You know what I'm saying? Next thing I know, hey, I always talk about the 7-day NCLEX, right? Always while I talk about it. 7-day NCLEX course is in its pre-launch phase. It's going for $48. Once you buy it, it is yours forever. And I'm updating it all the time. So help me build that Spirit airline plane so we can turn into an Emirates airline. You know what I'm saying? Where you can pay $10,000 to sit in first class, baby. You know what I'm talking about? So shout out to all y'all. And luckily, nobody got a 600 today. There were no 600s. Nobody got banned. Oh my God, Nurse Cass. Hey, y'all missed. Hey, there was my other moderator. She just showed up, Nurse Cass. Shout out to her. You know what I'm saying? Hey, we're gonna be doing this on Monday, same time. 7:30. Oh, I'm sorry, 7:30. 5:30. So 17:30 Central Standard Time. That's what we do. That's what we do around here. Okay. So I thought about doing NCLEX style questions like once a week, but I think y'all like it so much I may just do it twice a week. I just got to keep finding questions, and I just got to do it. I just got to put it out here for y'all. I know that y'all love it. I appreciate y'all. I appreciate everybody that likes. I need all of y'all to follow me. I need 10,000 likes. That way I ain't even got to sit here and do this. I could just do it from my computer so y'all can see, right? So when you guys follow, there's a notification bell. You just got to hit the notification bell, I think, on my profile, and then it'll be there. All right. So before y'all go, let me just, I guess some people jumped in here and they were just like, what does this fool look like? Well, I'm going to show you. That's what I look like. You know what I'm saying? Jason Derulo. That's what I get every single time. That's what I get every single time out here. All right. So we're hang out for a little bit. I appreciate everybody. That jumped into the live and that hung out, that answered all the questions. Just came on. Is this for PN or RN? It's actually for both. Okay. It's actually for both. And it all just depends on who you are and what you're studying for. And you need to know what you can or cannot do. Maybe 50 next time. Hey, you're asking for a lot. Okay. You're asking for a lot. I've already been on here for 2 hours, 2+ hours for y'all. You see what I'm saying? So sometimes that's just what we got. Maybe 50. Maybe. It depends on the day. It depends on what we got going on. Right? Atypical antidepressants. What are we talking about? We're talking about psych meds? Atypical what? What about atypicals? Oh, y'all just MAO inhibitors? Hey, tyramine. Be careful. Be careful with things that are tyramine, right? Right? First, second, third generation psych meds. Think about that. Speaking of that, I actually put up I have psych medication that I just put up where I talked about SSRIs, SNRIs, MAO inhibitors, atypical antidepressants. Got them all, baby. Got them all over there. So anyways, I appreciate y'all. NCLEX minimum is 85. Do it next time, please. Hey, you know what? Maybe, but probably not. So when y'all study, we'll do 85. When I do it, I will do 25. But that all just depends on you. If I get the likes, then we'll do it. Maybe we'll do a marathon. Just saying. Okay, Kevin, we about to be in the OR together. Thanks again. See you on Monday. All right, Adriana, I appreciate. Hey, look, OR nurses all the way, baby. Can you do mental health or farm next time? You know what? Since you just asked, I'll do that. We'll do farm next time. How about that? I'll do farm. We'll do pharmacology next time. Pharmacology is the second largest section on NCLEX. Yes, tyramine is contraindicated for MAO inhibitors. For nurses, you need to know what foods have tyramine because you don't want to go into serotonin syndrome. Okay? All right? You got to know that, Dr. Ashley Moore. We speak things into existence around here. You know what I'm saying? Old cheeses, right? There you go. Wines. There you go. Ma'am, are you teaching or am I? What are we doing? What are we doing up here? Right? So, somebody had already said pharmacology. We're doing farm. That's what we're doing. That's what we're doing. Pharmacology. Monday, 5:30, 5 p.m. Eastern Standard. No, it is 5:30 Central Standard Time. So it'd be 6:30 Eastern Time. I spelled that so wrong. Okay. I hate math. Look, my math ain't mathing. That's why, I'm not a mathematician and I'm not a damn architect. So, do you work in the ED? No, I work in the operating room. I worked in the emergency room as an EMT a long time ago. So, and 50 questions, right? No. So maybe, but remember when y'all are studying, y'all need to do the minimum. Y'all need to do whatever the minimum that is for the NCLEX. Bella, what you mean? All right. So once again, I appreciate all y'all for coming out. I'm going to leave you guys with a few things. Like I said, I failed my NCLEX 3 times. Three. 2018, twice in 2019. And then I took it again in 2020. I studied. I recreated the testing center for myself. I put myself on a schedule. I created a testing plan for myself. I knew where I was faulty at. Like I said, with this right here told me everything that I needed to work on. This right here, this breakdown told me everything I needed to work on. I have 3 of them. All right. So the question is what are you going to do about it? This is where you need to audit your time. You need to audit your life. Time management is life management. It's not just about what you have going on throughout the day, but how is that incorporated in your life? How are you ready to change things temporarily to set yourself up, essentially permanently, right? I failed once in July and it just got okay. Look, I'm telling you right now, don't come to me. Don't come to me and be like, Kevin, I failed. I'm scared. I'm crying. I'm going to be like, hey, get up. All right, cool. That's fine for you to cry. That's fine for you to feel that way. But I'm going to tell you right now, what are you about to do about it? Hey, remember, everything is your fault. Everything is your fault. Even if it's not your fault. And what you going to do about it? How you going to fix it? How are you going to fix what you need to fix? You ready to eat? Hey, I want you to eat. Even if it ain't at my table.
And everybody's invited to my table. I'm just saying. I'm just keeping it all the way real. All right. Oh, well, one board and still it's possible. Facts. There's a lot of good reviews out there. Of course, like I said, I will always recommend mine, but I won't shit on nobody else. You spicy. I love it. Look, hey, Victoria, you must be new here because I ain't never seen you before. And look. All right. I don't play no. Hey, a lot of this right here comes out. Like I'm real this. I didn't like Hurst. Not saying that the product wasn't good. It's just that the accents are just in a distraction for me. And I just didn't like the way that she taught. I liked Kaplan and I liked Mark Klimick. They helped out wonderfully for me. Didn't like UWorld. I think Archer is great. Simple Nursing. I loved his YouTube channel. There's other things that are out there as well. You know, and no, I believe you. There's a bunch of other people I know that have used Hurst. I don't shit on Hurst. I don't shit on reviews unless I know they're shitty. I'm just being all the way real. But Hurst helped you. Hurst helped two other people that I actually coached, you know, with the stuff that they had. It's possible. Counselor told me not to apply, but look, if I would have listened to them, I wouldn't be. Exactly. Don't let people who ain't walking the road that you walking tell you what you need to do for you. I'm just keeping it real. How do I feel about, hey, Dr. Z? That dude's cool. I like him. I like his stuff. His is very content heavy. I'm a very content heavy individual. Anybody who has just bought my course, you will see that there's content that's in there. What's meant for you is for you. Facts. All right. So don't be coming up in here, Kevin. Oh my God. I'm gonna be like, yo, get up. Like, cause like I said, like I'm a really understanding person, and I'm a really stern person. Right. It's $48, Becca. Doctor Who? Doctor Strange? What? Do you have any microbiology advice? These prerequisites are hard. You think prerequisites are hard? Wait till you get in nursing school, Capri. But definitely Khan Academy on YouTube for sure. Great investment for great future. Facts. Registered nurse's license. Look, that's what I'm talking about. Great. Who took his course and passed? So I've had people that have taken. So the course is relatively new, but the course is based off of my coaching, and you can go. Remar is good too. You can actually go to my YouTube and look at testimonies. You can go on the website and you can look at the testimonies for all the people that I've helped. My coaching that I've done is based off of. I'm sorry, what is it? The course is based off of my coaching, and so essentially this is my coaching on demand. Which YouTube do you recommend for heavy content? I like freaking Khan Academy was good. Simple Nursing. I love Simple Nursing's YouTube channel. I do. Like I said, I'm not going to sit here and shit on nobody, especially if they're helpful. You know what I mean? And like I said, I want everybody out here to eat. They got a bunch of there's a bunch of people. Remar, I know she does stuff too. You remind me of an NP I work with, very straightforward, and it's much needed in this field. I'm just trying to tell you, is because I don't gatekeep, I don't coddle, and I'm honest. Like some people are just like, I've had people come up to me who for one, obviously don't know how to read, will come up to me and just start, saying all kinds of outlandish stuff about my course. And I'm just like, did you read the website? They didn't, or, I have people come up to me. I've literally had people come up to me, like in the hospital I work at, and said, hey, your program's a scam. I was like, I don't know. Have you taken it? And this is coming from a student who has not passed their NCLEX. And I was just like, okay, email, blah, 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 .edu. I'll help any nurse trying to get into med school and become a doc. Hey, that's what you want to do. I'm trying to tell you, people be out here be trying to act crazy. You know what I'm saying? But that's saying, hey, if you want to come say something to me, here we are. We can do we can do dialect back and forth. You know what I'm saying? Failed 3 times. Also, we back in the lab. Let's eat. That's what I'm talking about. Hey, get out here. And make that plate. You know what I'm saying? So based on the question today, does that come from your course? They do not. I found those questions. I am actually, and I'll be completely transparent with y'all. I am actually working with a company that makes computer adaptive tests, because that's what your NCLEX is going to be. And I'm creating NCLEX style questions. So it's going to come in there with like graphs and all this other stuff. Hey, I'm a one-man army. I'm doing stuff on my own. So this is the stuff that I got to do. And I'm doing it for y'all because I didn't have this stuff, And so I'm trying to make it at least affordable for everybody. And that's why I said the pre-launch is there. We're going to be in the pre-launch phase for a while. So right now, the course consists of just content right now. So pharmacology, there's some endocrine stuff up on there, as well as what the NCLEX is, the changes, the type of questions, answering questions, the rules on the NCLEX. So like I said, look, Hey, we're projected for phase one, 130 to 150 videos that are going to be on there. That's what we're doing. And my goal is to have all that out before Black Friday. Yeah, once you get it, you have it forever. Yes, you get it once you buy. If you buy it right now, and if you're an LPN or let's say you're about to start nursing school, you'll have it the whole time. You graduate in December. Look at that. And I'm telling you, this is what I'm doing. This is what I'm doing. And it ain't like you can't find me. Hey, gone are the days back in the day where people used to just be like, oh, this is this, oh, this is that, and it ain't there. If you want to check the link is in my bio. Okay. Gone are those days where people can just do whatever they want and take people's money. Here I am. Here, and you see me, and you see what I'm doing, so you know I'm not playing no games. You know what I'm saying? Christian said, "What do you recommend for TEAS exam?" So there's a yellow Mometric book that you can get off Amazon. It's like $33. I would recommend the Mometrics TEAS book. That is a good book. Okay. I got 2 minutes before I got to get off here. 2 minutes. What else you guys got? I appreciate all the love. I appreciate all the questions. I appreciate all the concerns in regards to whatever a product is, because I know that I would want to know what's going on, right? But like I said, here's another thing. Here's my testimony. Here's mine. Here's one of them. One of them. So you know I'm not playing. You know I'm not playing. Hey, go check me out. Hey, go follow me on Instagram. You see what I'm saying? Go look at all the stuff that I got. Sketchy Farm for Farm is good. Go look at my YouTube. Go look at my YouTube channel and look at the video where I talked about I failed the NCLEX. Go look at the video where I talk about where I passed the NCLEX in 60 questions. Go look at my why video on why I created my YouTube. You see what I'm saying? Like, I've had people come at me all kind of crazy sideways. And this is no shade to none of y'all. You know what I'm saying? That's just the reality of what happens when you're trying to do something bigger than you. Because not only am I doing this because I want to do it, but I'm doing this in reality because I want every one of y'all to eat just like me. I want y'all to come out here into this shit show we call nursing. You know what I'm saying? I want y'all to come out here to this shit show of nursing, get you some experience, and then go away. Go be a travel nurse or go do aesthetics and, you know, and do Botox in people's faces or give them big old lips like mine. But these are natural, baby. Stop playing with me. You know what I'm saying? So, like, I'm telling you right now, your nursing license does not trap you into a fucking hospital. You feel me? It does not trap you into a hospital. I promise you. You can get out here, and I'm telling you, yo, there's so many travel nurses that are out here, and y'all know that COVID is going back up. COVID is going up right now. What do you think those travel nurse contracts are looking like? What do y'all think those strikes are looking like? I know some of y'all ain't gonna like the whole thing me talking about strikes, but I'm telling you, the bags are out here. You know what I'm saying? The bags are out here. All right, let me see what y'all said. The big, that's big. You admit that people never voice their. Here's that. I wear my failures like a WWE championship belt. I promise you. You're amazing, nerds. Don't let that test. Nope. The test will never define you. Right? An agency. Hey, look, 80 to 100 an hour. I'm trying to tell you, 60 to 50 an hour right now. Travel nursing. Who coming with me? Hey, Adriana, take them with you. Go buddy. You feel me? Anyways, I'm going to leave y'all on this last note. All right? Last thing. I want every one of y'all to be kind to yourself. Doesn't matter what you got going on in life. You could be in Ukraine right now. You see what I'm saying? You could be in a third world country literally worrying about where you're going to get your next meal or if you're going to get water, clean water. You know what I'm saying? I've been deployed twice. And, you know, I've seen different parts of the world. And we're very lucky, especially if you live here in the United States, of the things that we have. Right? So always be appreciative of things that you have. And always be kind to yourself because you only got one you. You only got one you. So be kind to you. All right? I'll do my last little plug. If you're just new here, make sure you guys follow me. All right? Hit that notification button. We do these all the time. I like to do this dialogue. I love talking to y'all. Make sure you guys go follow me on YouTube, Instagram, Thread, all those other good spots. You feel me? And 7-day NCLEX course, pre-launch phase. Pre-launch phase means we're still building it. And I say we because it's y'all that are with me. You feel me? So we are doing this together. Make sure you guys go check it out. $48. Once you get it, it's yours. All the way through all the updates. All right. And that's all I got. I hope everybody has a wonderful weekend. Also, since it's Labor Day weekend, I will still be here. My Instagram
all of my social media handles are all the same. The Boot Nurse, every one of them. So the Boot Nurse on Instagram, the Boot Nurse on YouTube, of course, the Boot Nurse here, all that good stuff, right? So you guys have a wonderful weekend. I will see you guys Monday. And like I said, be kind to yourself. Love yourself. I'll talk to you guys later. So bye.